Good afternoon, everyone. Welcome for this parallel session to the Brain Innovation Days, which is a very important development in the brain community. So we are about to open the final conference of the CSA BrainHealth. Make yourself comfortable. The room is quite atypical, I would say. But as you will have discovered, like many places and many areas in this venue, but we'd hope that it fosters a very good discussion and collaboration this afternoon. So without further ado, I'd like to introduce Ulrike Bussoff from the DLR in Bonn, Germany, who is the coordinator of the CSA BrainHealth, but also the coordinator of the upcoming European Partnership for Brain Health, to open the meeting. Over to you, Ulrike.
Thank you very much, Fred. So it's my great pleasure to welcome you to the final conference of the Coordination and Support Action for the CSA, so-called Brain Health. It's a great pleasure to be here, and a big thanks first to you, Fred, and your team to organize this final conference on top of the Brain Innovation Days. I know it's really, really tricky to have these different groups of people, bringing them together. Some of them are the same ones, so this is helpful, stakeholder involvement. So why are we here today? Well, our brain is our biggest asset. Our cognitive and emotional capabilities are the motor of technological innovation and societal progress. On the other hand, diseases of the brain and the nervous system drastically decrease quality of life, and in addition, they put enormous pressure on the people living with these disorders, the families, but also the healthcare systems, economies, and societies as a whole. In fact, neurological conditions are now the leading cause of disability worldwide. So, but unfortunately, far too often, there's no cure or treatment. So therefore, a coordinative and collaborative effort is urgently needed in this field. Welcome, come in. So transnational research efforts in the brain health fields have been among the priorities of the EU framework since the last decade, and a number of impactful networks have been funded, including the previous instruments like Neuron, JPND, EBRA, the Human Brain Project, and the infrastructure eBrains. The future partnership for brain health will capitalize on all these initiatives and these established structures. The aim is to generate innovative solutions to preserve brain health and to treat brain diseases and disorders. Since 2 years now, the CSA BrainHealth is laying the ground for this new partnership, driven by 21 partners in 11 countries and supported by the European Commission. And we have jointly paved the road by concentrating on 3 things. First of all, we have developed a strategic research innovation agenda. Secondly, defined the pillars of cooperation, including the governance. And thirdly, we have successfully reached out to new partners, envisaging a holistic approach on the brain health ecosystem. And today, at the end of these 2 years and the end of these projects now, we can proudly state the CSA has truly been a success. We managed to gather here now more than 50 partners of over 30 countries, inside of course, and outside of Europe for the future partnership. These include almost all EU member states and associated countries, and even several funders from third countries such as New Zealand and Canada. Together, they commit over almost 350 million euros for the future research and innovation actions. Alongside with the envisaged co-funding from the European Commission, we are looking at a total planned investment of approximately 500 million euros in the next decade. So therefore, the European Partnership for Brain Health indeed belongs to the biggest initiative worldwide in this field. However, all this money, all this budget, the best research results and most innovative solutions are meaningless until they are put into practice. So therefore, the European Partnership for Brain Health engages with several key stakeholder groups in the brain health fields. I'm very happy and very thankful you brought them together, because many of them are in the room here today. And this is first and foremost people living with brain health disorders. And we engage with patients and their advocates, families, caregivers in all stages of the research process. And secondly, the private sector healthcare professionals and regulators to make sure we always follow the path to innovation and translation. And third, with citizens and society in general, to increase trust, to reduce stigma, empower people to be active in their health trajectories. The European Partnership for Brain Health will grow beyond the sum of its predecessors. That's the promise. It will follow a holistic approach to take stock of all dimensions of the brains that overcomes traditional indication-related boundaries. For the first time, all actors are brought to the table, from applied research over clinical translation, new applications and technologies up to innovative strategies for the future. A big thank you to all our partners for this hard work to bring us here and this dedication. And I wish us now a successful final conference.
Well, thank you very much, Ulrike. And as a way of introduction, we have the pleasure to have the European Commission represented through Kasia Ziorzak. Kasia is the head of unit for combating diseases at DG Research and Innovation. Kasia, over to you.
Thank you so much. Good afternoon. It's really an amazing venue, more like a theater show it feels than a conference, the usual boring conference venues in Brussels. So well done. I think we are, it's for me, it's been a journey of just over a year. We have seen each other last year and in several events that European Brain Council organized on the matters of brain health. You've asked me very kindly to be one of the 3 commission speakers today, so I will try to say something complementary to what was said before and add to what my boss will be saying in the closing panel, and you'll have a chance to speak with Pilar, who is our new director, who started in her role just in September, replacing Irene Nordstedt. So you've asked me to speak about brain health and prosperity, right? I think what's very clear is that our joint vision here for the future of brain research and innovation is grounded in that, in the concepts of prosperity, resilience, shared responsibility, and I would also say cohesion, right? Because I heard that this morning the emphasis on competitiveness was perhaps not as appreciated. I mean, we have to show the balance, really, that it's jointly focused on competitiveness, but also kind of human health, public health, and societal cohesion. And Europe has very high ambition that our President, Ursula von der Leyen, President of the Commission, emphasized in her State of the Union address in front of the European Parliament. She shared the vision of Europe becoming a global hub for research and innovation. And that's a really exciting, thrilling vision I'm sure many of us would love to sign up to. And we see very strong foundations for it, but we also understand there is a lot to be done for it to materialize and kind of for Europe to go back to playing a central role in global research and innovation. So we definitely have our scientific excellence to build on, but we have to put it in the context of societal well-being, competitiveness, and economic resilience. So the world is a complex, the global situation is very complex. The global economic headwinds and geopolitical tensions make Europe, force Europe, even more than before, to act strategically to secure its place on the global stage. And from its side, the Commission proposed doubling of its budget for research and innovation for the next framework program, which will be called Horizon Europe. This is Commission proposal, and the representatives of Commissioner Zaharieva's cabinet, Manuel, this morning told you that this is just the beginning of the negotiations, right? So that's the proposal where the Commission sees the added value of the EU budget going into research and innovation, into defense, but investing in research and innovation and competitiveness should be our joint endeavor. And as I said, it's the beginning of the conversation because the negotiations in the Council will take place in the next 2 years, so in the Council, but also in the Parliament. And you represent the research communities from across the European member states, and our plea is also to you to make that voice heard not only to your research ministries, but mostly to the finance ministries, European affairs ministries, to show how that vision of prosperity, resilience, economic strategic autonomy can be built through investment in research innovation in brain health. Okay. In terms of other strategic priorities, so we are hoping to have the budget boosted in the next financial framework. In terms of policy priorities, those were laid out in the European Life Science Strategy that was adopted in July, that shows that, okay, broadly, life science sector is a sector that can drive Europe's competitiveness, and we have very important job to do here to make it easier for the sector to do its research and to translate the research into innovative products or services. And that's why also another strategy on startups and scale-ups and the fund, the Startup and Scale-up Fund that will be created, are to help companies, researchers, innovators to put their innovations on the market and available to the broader public. And also coming back to this message of being globally a global leader and looking at the geopolitical situation, the Choose Europe campaign, right? That's something that the Commission President also announced, encouraging academics from across the world to come to Europe and build partnerships and build their academic careers also on the European continent. So, hey, this is important for the economy, for the security, as I said, and you have all made a very convincing case about investment in brain health not being a cost, but actually an economic multiplier, something that will offset in the future, because down the line, the results will improve workforce productivity, enable longer, healthier working lives, happier lives as well. So in terms of investment, and Ulrike already pointed to that, from the EU budget, there has been, and since 2014, so since the previous framework program, the EU has invested over 7 billion in brain research, and that covers everything from basic science, clinical research, public health, funding research projects, dedicated infrastructures and networks, coordination actions like this one, and crucially, the innovators. And what we want to do going forward is really rethink how we fund research, right? And even better align through vehicles like this partnership, national and European funding, enable greater contact between academia, industry, healthcare systems for translation of these research results, but also accelerate and simplify regulatory pathways, because we do understand this is an issue in Europe. And the future Biotech Act will be an occasion to address some of those shortcomings. From our side, from the side of DG Research and Innovation, being a funder of the partnerships of infrastructures, we are looking at ways in which we can make the funding, especially for clinical research, more predictable, longer term, and agile. And in the life science strategy, we have announced an action, which is clinical research investment plan, which will look at these two things: the investment angle, so the funding available, importance of leveraging private funding in a smart way, and the infrastructure that is supported from the EU and national levels. And that should work hand in hand with a legislative framework that would be more, again, easier, accessible, and less burdensome, because we understand that Europe's share of global clinical share of clinical trials is declining. I mean, it's steady, but other regions in the world, their share is growing. So that's why we see very much this coordination and support action as a cornerstone of our ambition. So that's where, in the area of brain health research and innovation, we want to see the national efforts brought together, aligned with the big kind of policy priorities, the partnership structuring brain research, and in a coordinated and impact-driven way. And Ulrike, as you said, let me just highlight it again, that the brain is the most valuable asset. The colleagues, I think the colleagues from the European Brain Council or associated to it are promoting very much this narrative of brain capital, brain economy, and it's definitely something that we would love to give more visibility to, and again, writing it in the broader competitiveness narrative. Voila, so in sum, I'm looking forward to the next chapter, so the actual start of the partnership, because we've been saying the partnership's about to start, it's about to start. So it is starting in a couple of months, and I wish it very well, and I hope it will hit the ground running, and that we'll see some impactful results coming soon. So Ulrike, over to you, for your vision.
So thanks a lot, Kasia, for this nice introduction. We started in this morning, and the first speaker really started with a rather gloomy introduction to the situation. I will pick up there and make it even more gloomier. So just shortly to remind you on the challenge, yeah? And that is, I know it's more modern to talk about investments, but health ministries, they talk about costs, to be honest. And that's why we also talk about burden of disease. So we are facing huge challenges in the field of brain health in Europe and worldwide. It's an estimated more than 3 billion people currently living with a neurological condition and 970 million with a mental health disorder. So neurological and mental disorders are now a leading cause of disability and second leading cause of deaths in Europe and worldwide. As you mentioned, Kasia, there is some pressure, so it's democratic changes and the current geopolitical situation, environmental crisis, and economic pressures. They are also increasing in many countries in Europe and beyond. And so all these together have further aggravated brain health problems, and in particular with the most vulnerable populations. So consequently, the burden of disease and the economic costs of brain disorders are enormous. On the other side, there have been, in spite of all this, considerable efforts and investments in research and innovations within the last decades on European as well as national and regional sides. There are no effective prevention strategies and therapeutic options for many mental neurological disorders that are accessible for everyone, and so they are all still lacking. And therefore, maintaining brain health and coping with the burden of disease of the brain disorders are paramount for all societies in Europe and beyond. And however, given the scale of this problem, so this is really clear that no single country, no single region or ministry budget can tackle these challenges on its own, but we need here a holistic and collaborative spirit and approach which is coming together and bringing together these possibilities to invest in here. So for what we've seen already, and Kasia mentioned that, is for the last 2 decades even, the EU has funded several large initiatives and programs that have been established to structure and to align brain research and to enhance cooperation and collaboration in Europe and beyond. And you see on that picture the previous initiatives, a lot of abbreviations. It's NEURON, GPND, the former CSA project, EBRA, the Human Brain Project, and now the infrastructure eBrains. And the new partnership will capitalize on all these initiatives and establish structures. But the partnership per se will grow beyond these, some of the predecessors, and follow a holistic approach for brain health. And that means involving all the stakeholders, including more funders and national ministries, be it on the regional or the national side, but also targeting, for example, ministries of health, researchers, patient organizations, healthcare providers, private sector representatives, policymakers, and regulators. So a long list of stakeholders Furthermore, the partnership will reach out to complementary European initiatives. Some have been mentioned already in the morning, for example, for IDERA, but also on a global side, so global initiatives and organizations in the field to build synergies and to implement interfaces to innovation and implementation to realize the aims of the partnership. By this, the overall idea is to create a new ecosystem for brain health research with tangible impact for societies, strengthening the competitive position for its partner countries worldwide. To pave the way for the future partnership, the Coordination and Support Action Brain Health was funded by the Commission, and this was the last 24 months. So this October, so we started in 23 November, and so this month is the last month of this project, and that's why we're here today to celebrate its final conference. And as I said before, this is already a nice effort because there were 21 partners from 11 countries just to prepare this partnership. And the overall idea was to address policymakers and funders from European member states and associated countries and interested like-minded third countries and other stakeholders to closely interact with the research community also. But the underlying theme of the CSA is to prepare the partnership for brain health. So I will introduce shortly on the next slides the main objectives so that you get an idea what we did in the last 24 months. And the most important part is to develop a joint strategic and research and innovation agenda, the so-called SRIA, one of these nice abbreviations of today. And it was developed under the leadership of our French CSA partners, ANR and INSERM, in a consultation process with the research community, with future funders of the partnership, the European Commission, and other relevant stakeholders in the field, including patients and industry representatives. In this process, 4 overarching research priorities and a number of transversal priorities were identified, and you will hear a lot more about this with the speaker of Catherine Macaire, our French partner who is leading that effort. This second objective was to develop a governance structure and a work program for the partnership in consultation with the future funders in the European Commission. And that draft concept was published last year in July already. On the third objective was to gather partners for the partnership and to create a basis for this nice brain health ecosystem. And a joint proposal was submitted this year in June that has been positively evaluated by the European Commission, and we are now currently in the phase of the grant negotiation. So still on track with a very, very ambitious schedule as we envision and plan to have the partnership to be starting in January next year, so 26. And now just a very short glimpse on what we are planning to do and how we are constructed. So we currently have 54 partners from 33 countries within and outside Europe. That means 25 member states and 7 associated countries, including New Zealand, Iceland, UK, and Israel. And the vast majority of the partners are public funders. So that's the way it is being constructed. In very few exceptional cases, we have non-funding partners in the partnership. And the idea is the filter there was bringing in essential competences and expertise that cannot be covered by public funders. And these non-funding partners include our kind host today, EBC, as well as the European Infrastructure eBrains, which is also present today somewhere, busy, and the French National Institute of Health and Medical Research in CERN, seen that also with them. In total, the funding of the funding partners are contributing, as I said before, you see still there's 340 million, so this is a volatile number because we are still negotiating with some of the member states, but it will add up more or less in total in this number or until up to 350 million for the next decade. And as this funding instrument is a co-funding one, that means it generates a top-up budget by the European Commission of around 145, more or less, million euros. And this is a great success. I mean, if you watch the news, the new normal is uncertainty, I've learned yesterday. bringing so many countries, so many ministries and governments to earmark budget and to put that into their budget plans for like 2 times elections, that means like for a decade, yeah? To earmark this kind of budget for 10 years for one topic. This is an incredible thing to do, and it also tells, I mean, we always talk about investments and burden of disease. It tells you why the governments are doing that, because the pressure is so high. And it's the first time we are creating a platform which is bridging from neurodegenerative to neurological and mental health. So this is why it's so attractive for these governments, because they do not have to earmark for one single topic, but they can cover the entire range of brain health and then allocate in the years for the different calls their priorities according to the national agendas. Okay, so for the next slide, what I would like to do is to tell you how we framed this kind of partnership. And we have developed a joint vision and mission statement for the partnership, which is improved brain health for all, developing scientific knowledge as a ground to promote brain health throughout a lifetime. That is also very important, to prevent and to cure brain diseases, as well as to improve well-being of people living with neurological and mental disorders in Europe and beyond. So that's the vision statements we are operating on a mission side that is all a very centered approach on research. That means support brain health research and innovation by strengthening transnational collaboration and alignment, to promote the translation of results into tailored solutions for prevention, diagnosis, treatment, and care accessible for all. So this is the 2 mission and vision statements we are operating under. And to realize that, overarching goals have been defined. There's 3 general objectives of the partnership that further reflect on the operational level. And as you can see, the first objective is focusing on improving the scientific knowledge around the different levels of prevention. The second objective is targeting solutions for diagnosis, treatment, and care. And the third objective is the partnership as an innovating collaboration structure. So how do we plan to implement this? These objectives are feeding into 4 central hubs that have been formulated as a means to align our efforts and results towards the EP overarching objectives, outcomes, and impacts. You can see here that the hubs are focusing on themes which are at the core of many member states in the European Commission, and you heard that already in the morning also in Kaisha's statement. Even though you might have different feelings about competitiveness, it's still at the core, and obviously this is also something we are also addressing. So it's competitiveness and innovation, building capacities also, and structuring the right ecosystem. So trying to reduce the gaps we're seeing, and which have been mentioned also during the talks in the morning. This is a huge endeavor. So on the operational level, the so-called EP work plan with its work packages is full of overwhelming detail. Well, the design is overwhelming. So if you look at this, this is the way we will structure our work. This is also later on the web page, but just to give you an idea, to grab some of the details here, I would like to point at some of them. At the core of the partnership, there will be transnational funding of research and innovation activities. And obviously, as we're talking about competitiveness and also sovereignty, the important part here is also not only to fund this kind of research and innovation actions, but also to monitor what is coming out of this. So monitoring the results of the funding is really something key, and we want to be able to track this kind of impact we are funding there. Besides the joint funding activities, there will be an extensive set of so-called integrative activities, and this is, for example, acceleration of translation of brain health research results into praxis, and that means also engaging with the private sector and regulatory bodies. But equally important is the empowerment and involvement of patients and society throughout co-creation, multidisciplinary collaboration, and training. So that will be also an important part of the partnership. And then there will be a broad range of activities supplementing that and supporting that. And that means, for example, strengthening international collaboration, enhancing global visibility, aligning scientific strategy with evolving priorities. I mean, we're talking about a decade of a program, so obviously we have to adapt and see what's coming up, and building future research capabilities. So this is by improving the use of existing data, tools, and services, by promoting high-quality standards, or by supporting early career researchers. Obviously, all these activities have to be embedded in communication dissemination activities, raising awareness and showcasing the results we're getting out of this kind of funding. What is coming next? To summarize here, as we mentioned before, we are now in the middle of the grant negotiation phase with the EC, and we want to start in January 26. And this will be really a kickstart, because we have never seen that before, that a partnership has started from the first day on with the publication of calls for research projects funding. And you can see that already on our webpage. So there is this pre-announcement there. 42 funders have already expressed interest to participate in these first 2 calls in January 26, and the pre-announcement is on our webpage. There will be more information following in December, but here you can get already an idea what it's about. So the first year of the European Partnership, we will focus on biological, social, and environmental factors impacting the trajectory of brain health across the lifespan. And for political and technical reasons, we will split that in 2 calls. One will focus on neurological, mental, and sensory disorders, and the other one is for neurodegenerative diseases. But like this, we will cover the entire space of brain health research in this field. So I hope that gave you a good grip of what we are planning to do. Obviously, the expectations are high, and it still has to get started, but that gives you at least an idea of what we are looking for in the next years to come and what we are trying to achieve there. And you will hear in the talks during today's conference, you will get some more details on that. Thank you for your attention.
Okay, and actually, as you're joining your seat, I simply wanted to make a very short comment on the design of this afternoon's program, as we wanted to alternate now that we enter into really the specific of what the partnership is going to look like. And I know that we have many partners in the room, but also quite a few new faces discovering the outcome of this work, and looking for a certain number of elements of information in what the future is going to look like for the community. And hence the design of the program with discussions, and we are now turning to our first panel representing the community and entitled on the structuring the brain health ecosystem. So I'd like to call on stage our 3 panelists, Tom Ryan, who is the chair of the FENS Advocacy Committee and a board member to EBC, Raluca Nica, who is a board member to Gamian Europe, and Daniel Wojcik, who is a member and now president already, or soon, maybe one day, okay, of the IBRO-PERC, so the Pan-European Regional Committee of the International Brain Research Organization. So please join me on stage. So it's a free sitting. Sorry, I made a diplomatic mistake. I hope not. So yeah, I know, Lars. Sorry. So grab a mic, and actually, I'd like maybe to start with you, Thomas, because it's a topic we've been discussing quite a lot within EBC, but you've joined also quite a few of the meetings of the CSA BrainHealth. It's obviously very important for the organization that you represent, FENS, but also the organization you serve, EBC, obviously. Can you share with us maybe the thoughts and the perspective with such a development in the ecosystem? Because obviously it's something long awaited for. There was a bit of uncertainty as to what the different initiatives were going to look like when they would be stopped. And now we have the partnership, which was said, I can't remember if it was Kasia or Ulrike, aiming to represent and achieve more than the sum of the predecessors.
Well, it's wonderful to be here. And let me start by just saying congratulations to everyone who's been involved in making this happen and getting the Brain Health Partnership over the line. I think it's a fantastic instrument for European neuroscience and indeed European collaboration in general. Representing the Federation of European Neuroscience Societies, I would come at this from two perspectives. One, what does this mean to the neuroscientist? What does this mean to the person doing the research? And second, what does this mean for the neuroscience community in Europe going forward? How can this be a model for future similar initiatives? And what place does this take in the advocacy space between science and politics that we're hearing at Brain Innovation Days in general? And the first thing I would say is that when you're doing neuroscience in the modern world, it is extremely competitive, and it should be. Our job is to help make European science more competitive and contribute to the outcomes of that. And in order to do that, we need resources. And those resources have two features, two axes, which make them effective in allowing us to be competitive. One is volume, or the size of the financial support. And the other is flexibility, or the ability to just get on with the research in an unconstrained way. And we heard good remarks from the cabinet member of DG Research and Innovation on the importance of harmonizing our funding and career mechanisms across Europe to make researchers' lives easier. When I look at the products of what's going to come out of this, I get excited about the idea of that in January I can start to apply for these kinds of projects with colleagues across Europe in a coordinated way. At the same time, it's going to be incredibly competitive, like all funding sources are, and pretty much every funding mechanism in Europe has become twice as competitive in the last year on account of what's been happening in the USA. We've seen this with the European Innovation Council. We've seen this with the Marie Curie applications. Literally, the success rate has halved in 12 months. That's what we're all facing. But if one is successful in acquiring this funding to do the science, a group of scientists are going to be getting, between 2 and 3 million euro in a grant, and it's probably going to come to around 300,000 or 400,000 euro per principal investigator per research group. Okay, so that type of money can be extremely effective for catalytic research. It can be extremely effective for allowing researchers to open up new ways of engaging with research, engaging in new topics, in new collaborations. Indeed, there will be multiple PIs on each project. What it's not able to do is deliver high-impact research on its own, because for any funding mechanism to deliver high-impact research on its own, we're talking about 1 to 1.5 million euros per principal investigator per project. That is the world we live in. That is what we're competing with the USA, with Canada, and with every serious scientific country. So my view as a researcher is the Brain Health Partnership needs to do everything it can to allow researchers to be as flexible with this funding as they like, and to understand that it is going to be impossible and unrealistic to expect people to produce impactful outputs within 3 years or even within 4 or 5 years of getting these awards. If you want this to be leading to high impact outcomes on science and certainly on health, there's going to have to be no expectations beyond the scientists doing ambitious research as a platform, as a launch pad to then acquiring much larger funding sources for each individual scientist in order to then engage in the full possibility and the full potential of this mechanism. So to summarize that part, I think it's about catalytic funding, to focus on the catalytic aspect of this, and also to create a minimal amount of bureaucracy for the researchers in general. And the second point, which will be much briefer, we all have to be defending neuroscience funding in the next 2 years. And it is extremely important that when we are engaging with policymakers and when we are engaging with officials at every level, that we keep things in perspective. I've engaged with MEPs and I've met numerous MEPs where I'm talking about why it's important that we fund brain research in Europe. And some of them will say, well, we've heard about the Brain Health Partnership, isn't this already taken care of? And some of my colleagues have been asked this question and it leaves them in a slightly difficult position. Because we also need to be lobbying for the doubling of Horizon Europe budget as the Commission has already proposed. And we have to get that through the Parliament and we have to get that across our finance ministers and our research and innovation ministers at the European Council level. And the perspective that we have to have on that is that in any given year, the European Research Council alone contributes about 150 to 175 million euro to neuroscience, just to neuroscience. And that doesn't include the European Innovation Council and, of course, the broader Horizon Europe program. It's 175 million euro a year over a 6-year period for one Horizon program. That is €1 billion for neuroscience. And what's on the table now is doubling the ERC budget to nearly 45 billion euro, which will result in 2 billion euro for neuroscience over a 6-year period. And that is now ours to lose. We have to make sure that that Commission proposal makes it through the next 2 years so that it becomes reality. And that is an enormous task, and I think we need to do it as a community. And we have to remember that when we're talking about our successes, of which the Brain Health Partnership is a significant success of European neuroscience, we have to keep it in perspective as one aspect of a much broader community, which when we're advocating for neuroscience needs to be told in a coherent story with appropriate perspective.
Okay, thank you, Thomas. Daniel, I'd like to turn to you immediately. I'm not asking you if you share Thomas' point, but that's a part of the discussion afterwards. But what is your perspective and what is the potential that you see with the upcoming partnership? It works, you simply need to start talking.
Okay, thanks. So, yeah, maybe I'm not feeling as desperate as Thomas, in the sense that as we saw this morning, for instance, in the Andreas presentation, the European funding is just like 6% of what's available to us. And of course, the main challenge that I'm seeing in the current funding landscape in Europe is that it's very inhomogeneous. It's like depending on which country you look and which structure within Europe, it's difficult to maybe to integrate, to access. So I would say fragmentation is present on many different levels. So one thing is that the different communities are not always able to communicate. Like when you think about, say, molecular neuroscience and cognitive neuroscience, computational neuroscience, artificial intelligence, we often have very different curricula, and it's very difficult to talk to each other. And then when you look at programs like the ERC, EIC, ERANET neurons, and the national funding, there are often very different rules, and the access is not always easy for people in different countries. Also, when you look at, say, the data collected in different countries, it's very often fragmented between different biobanks and even individual hospitals, and we often lack common formats even for data exchange and things like that. So the way that I'm seeing the European Partnership for the Brain Health is, I think, can be this sort of connective tissue across all those changes that we're seeing. So from like individual projects supported through the ERC to the innovation, I think we heard this morning that we still have this problem of bringing in the innovation from the individual projects. Something is lacking. So I don't know if the partnership is going to come about, but that's the way I'm seeing it, that it has a chance to provide this. I'm also hoping that it might foster this integrative aspect also at the level of training and sort of bringing people from different fields to talk to each other. And maybe last but not least, sort of as being a member of the IBRO-PERC, so the International Brain Research Organization, we have a global perspective. So obviously, PERC, which is the Pan-Europe Regional Committee, is focused on Europe, but we are sort of collaborating with all the continents. And I think it's very important that we do not operate in vacuum, but sort of integrate those efforts with the global efforts. And maybe I'll stop here.
Allow me to say also that there is an international flavor to this afternoon's event because it was meant to mirror the global potential and the global outreach activities that we conducted within the CSA, but also that are upcoming with the partnership. So we have colleagues from Africa, from Canada, and Australia as well. And I see also, I don't know if Alex from New Zealand was there. So we've got a handful. But obviously the partnership, as it was presented, is meant to serve a purpose and deliver an impact to address the unmet need of brain disorders. Raluca, you represent Gamien Europe, which is one of the two patient associations involved in the partnership and in the consultative process. I'd like maybe to invite you to share with us your perspective on behalf of Gamien, but also maybe your hope and wish of success.
Okay, thank you very much. Thank you. Thank you very much, first of all, for the invitation on behalf of my colleagues from Gamien Europe, who are also represented here in this room. And thank you for seeking the opinion of those who are living day by day with a brain health condition. Actually, they are the end users of the system, and every system that it's built for patients must be built with patients. What we need in this ecosystem we are looking for, we need a few things in our opinion. First of all, we need to invest in what we know it works at this moment. And what it works is prevention, early intervention, and community care. The actual system that we have, it's a kind of crisis intervention system. We are letting people to drown until we are offering them a life vest. And I think that we should invest more in community-based services, maybe in youth mental health centers and online CBT tools, and move resources from big, large institutions to the community where people live and recover. What we also need is champion research and innovation with patients, because at this point, and I think we will agree on that, research is focusing mostly on drugs and also on biomarkers, which are definitely very important. They reduce symptoms and we need that. But beyond that, we also need to research what is effective as a therapy for people. What makes, how does really look a day-by-day recovery, and what makes a patient feel when beyond reducing the system. Also looking to technology, and we have an avalanche. I was talking with a colleague from Hadia during the lunch break, and she said, AI projects. It's almost a nightmare at this moment. So we don't want AI to become a nightmare. We want AI to support us, not to replace human connection. And we have to be very careful in this area. What we need to create patient-led research agendas and fund studies that are also looking to investigate the social determinants such as poverty, loneliness, discrimination. We also need to fund the development of tools that are improving the quality of life, not only reducing symptoms. This is essential. We do need to radically empower the patient voice, and they should have a place at the table of research committees or decision makers and hospital boards, because we should not forget they are the end users and they know quite well what the needs are.
Well, thank you, Raluca. I would like to check if there would be any questions or any reaction within the audience by a raise of hand. And apologies for those at the back because there is a very strong light. Marco, I'll come to you. But is there anyone wishing to comment? Daniel, you had something more to say? No? Okay. So Marco, I'm coming to you.
Thank you, Fred. Thank you for a very good, stimulating beginning of the conversation. I had a question. I'm Marco Mowinckel. I represent TechTour here, which is a community of entrepreneurs and investors. And I'm very much focused on channeling more investment into mental and brain health and what works. So to that point, all the things that I've heard make a lot of sense, but I wonder within the scope of the European partnership that is starting now, there's any mechanism to support innovation that can be scaled. So, and if you can comment on that, because we do have things that work, but are not reaching the patients. And I'm not talking about drugs.
Okay, so I guess it's more a question almost for the coordinator, but if you would like to add to what Marco was saying. Ulrike, you're ready to answer? Or we wait for the second keynote by Catherine on the strategic agenda to push it up?
Yeah, that's what exactly I wanted to say. Catherine will probably remark more on that, but there will be a format of innovation calls also within the partnership, but not in the first year.
So there is a bit of teasing for the session number 2, so which is great. Thank you, Marco. Any other questions to the panelists? Yes.
Thank you. Cezary Mazurek, Poznań Supercomputing Center. I was really interested in the topic of developing the AI support for helping to understand better the disease mechanism and also assess the treatment results, maybe help people in recovering from the good style of life after the strokes and others. Do you think that the current part of the structuring of the brain health ecosystem will require also to build a knowledge hubs? And what will be the central hubs for those knowledge hubs to help better understand data and better analyze data and to find the competences which will be more than interdisciplinary, maybe even transdisciplinary among the cognitive scientists, computer scientists, neurologists, and others. How to drive those hubs in the partnership model also in the national level, at the national level?
Well, definitely this is a very complex question with several questions in it, and I can't say it will be easy, but we see a lot of cooperation, as you say, among different professionals and different levels of professionals, but also among scientists from different countries. And you are right, we need to cooperate more and to work and to build these hubs you are talking about so that we can use them to our advantage and incorporate artificial intelligence in such a way that it helps us. There is, I mean, probably it will be a quite long discussions, and we see countries, adopting policies with regards to how to use artificial intelligence, because when your child has as a best friend, GPT or DeepSeek or whatever, that's a problem. So we have to work this artificial intelligence in such a way that we don't lose as a human species, but we gain. And this can be made only in getting together and trying to find out how to do that. And with definitely an interconnection between different professionals.
Yeah, so maybe I'll just say this. I think that I don't believe in AI solving all our problems. And I think that, we need the context, and we need the specialists who will take place in the interpretation of the stuff. And that sort of points back to the fragmentation that I mentioned. I mean, even sort of, putting aside the context of funding and putting aside the context of of artificial intelligence, I'm seeing very often it's very difficult for us to communicate across the disciplines. So I think that this is really the priority. What will be the role of AI in this? I don't know. But I think the first thing is we need to be able to talk to each other. I mean, the experimentalists, clinicians, the modelers, and then to move on with say biomarkers, for instance, and then going to diagnostics and then to treatment. I'm sure AI is going to be instrumental, but it's going to be like one partner or one component in the bigger ecosystem. That's why I think that actually having projects which of necessity involve a number of partners can be beneficial. I'm a researcher. I'm a basic researcher, so of course I'm a great fan of bottom-up projects. They are of course critical to the development, but very often I'm just seeing that such projects may get stuck because people completely rely on their own competence. Like I have colleagues whom I admire and I think they are excellent researchers, but very often I just see that they have this perspective of reaching a certain thing and just getting extra grad student, master students, hoping they will solve all of the problems, while not trying to seek the expertise outside. So I think that those bigger projects, such as which can be provided within the partnerships, as I understand it, I think they could enforce sort of this operation in the broader context. And I'm talking about the different disciplines, but that would also include diversity in many different aspects, right? Across the countries, across the generations, involving patients, and so on. So I think that's very important, and we need this.
Yes, Ira Helsen, AR Mind, Norway. Thank you so much, Thomas and Raluca, because I think you pointed exactly how little money, in fact, there exists. And I do not think that we need to get better researchers. We have very good researchers. What we really need is to implement what we have already researched. And we are again and again in consortia, in nations, re-eventing projects, ideas, infrastructures. And that has to end. Time is short, and AI will help us. It is very well, should be as much as possible integrated in our approaches, as it will accelerate. And our competitors are two big nations, and they have understood it, and we haven't understood it. And Europe lacks the implementation of great ideas. And the patient is unnecessarily suffering. The discussion, for example, the simple discussion, ending this stupid MMSE and MOCA testing in classifying dementia, for example, instead of using digitalized opportunities, much more sensitive for earlier stage. And it's always harboring resistance. And I think we should focus our money on these simple implementations of little steps with huge effects.
Thank you. And obviously, we are reaching the end of this panel. So can you think of an answer as a way of a conclusion to the discussion that we've had? And I don't want to put anyone under pressure, so you can self-manage who wants to kickstart on this one. Thomas, ready?
So, yeah, thank you for the intervention. I couldn't agree more. We are competing with the US and China. They're currently ahead of us in both investment and in terms of quantity of scientific outcomes. And certainly the US is ahead of us in the quality of scientific outcomes. This is a choice. We have a significant advantage in Europe. And I don't like this term, but I've acquired it from spending lots of time with Fred in Brussels. But we have the most brain capital in Europe. Right, because we have more young people than the United States, and they have more access and ability to become scientists than people on large currently do in China. Of course, that will change. What we don't have is the research funding supporting those researchers, which is why we've had so much brain drain to the United States. But we need to start thinking of this as an existential issue, and I don't think that's an exaggeration. There are advantages here for us too, because we're concerned, rightly, with dual-use research funding. We're concerned that the next Horizon budget will be for dual use and therefore may be prioritized partly for non-civilian projects. But there's a flip side to that coin, which is that Europe is committed to spending a very large proportion, 5% of its GDP, on defense. Now that can include research, and we shouldn't be, in my opinion, we shouldn't be afraid of this. My own research group is funded partly by the US Defense Department. We do no weapons research, it's fundamental science. And we are not controlled. We have complete autonomy in how we use that funding. But the US Department of Defense is interested in fundamental neuroscience. It doesn't think it has a choice not to be. And I'm surprised when I speak to MEPs in Europe where they ask me, why on earth would defense have anything to do with the brain? So we need to expand that conversation, and we need to think about science as being fundamental, not just to education and as culturally valuable as an exercise, but to medicine, how we change medicine, and to our own security.
Thank you, Thomas. Raluca?
Well, I think we are talking about artificial intelligence, and we forget that at first we have to start cooperating as human beings so that we can use properly the artificial intelligence. Thank you.
Daniel?
So I realized I might have been misunderstood in saying that the situation with funding is not so dramatic. I don't mean to say that we don't need more funding or we should reduce the funding for neuroscience, but I think that even a huge amount of funding will not help us improve the challenges which I see in the fragmentation, and I think that this is really where we should focus on. I mean, just looking at those big countries that were mentioned, like the US and China. I mean, evidently the translation from the fundamental research to innovation is somehow working better. And I don't think that this is only the issue of funding. I mean, while I agree that having more funding would help, but I think that the problems are elsewhere, and I don't know where they are. And I'm thinking that this is really trying to to build the bridges between the different communities from ERC to EIC, and perhaps the European partnership will help a little bit with that.
Thank you very much. Please join me in thanking our panelists as we are concluding this first session. And I'd like to invite on stage for second keynote, Catherine Marquer. Catherine is the International Scientific Officer at the Agence Nationale de Recherche. And Catherine, you're going to introduce to us the Strategic Research and Innovation Agenda. And here is the clicker.
Hi, everyone. So while people take a seat, I'm just going to take a second to thank Fred and the EBC team for putting together this beautiful program. So we all know how difficult it is, so thank you for that. And I'm going to apologize for the CSA members who have already heard me talk about the agenda many, many times. But there are also people here that I don't know yet. So I'm assuming they don't know that much about the agenda, so this presentation is for you. So today I'm going to talk a little bit about brain health, right? Because there's always this question, what does it mean exactly? So what we decided to do is start from the WHO definition that you have here. So basically it says that brain health is a state of brain functioning across cognitive, sensory, social, emotional, behavioral, and motor domains, allowing a person to realize their full potential over the life course, irrespective of the presence or absence of disorders. So you can see it's quite large, right? And we decided to embrace this definition, but also to add a certain angle to it, because we recognize that neurological and mental disorders, so both, are leading cause of disability in Europe and beyond. and that we wanted to emphasize the burden it represents for patients, families, caregivers, healthcare systems also, of course, and societies. So we really had this approach, and that's what matters to us. We also wanted to pinpoint that we support science-based interventions in case there was something we needed to clear up here. So what do we mean by brain health? So we mean, on the one hand, good health. All right, so that means prevention. You can see here many ways you can try to improve your brain health, but also embracing the diversity of the population that we want to take care of. And it goes all the way to bad health. So here we're including neurology, whether neurodegenerative or not, psychiatry, and sensory organ disorders. So when we decided to begin the SRIA, so I'm going to use this acronym a lot, Strategic Research and Innovation Agenda, we started from multiple documents. So first, we had all the initiatives that Ulrike just told you about, right? The ERANET Neuron, Human Brain Project, JPND, the CSA EBRA. So they all had produced strategic agendas. So we decided not to reinvent the wheel and start from there. But we also reached out to national funders and ministries because we wanted to know what their priorities were, right? Because if we want to align on something so important, we needed to understand where we converged, on which topics. And that was quite interesting, actually. We also conducted, here what you see, here, on the figure is a survey of all the national plans. So you can see you have countries that have dementia plans, you have some that have mental health plans, you also have a few countries that have both, and the little orange stars are countries that have brain health plans. And you can see that it's not that many, right? So we really thought that there was a need there. We also looked, of course, at global initiatives that operate in the same field, so WHO, OECD, NIH, and so on and so forth, and position papers in major journals. So the writing group was supervised by INSERM and ANR, but we also had contributions from all the CSA partners. And something I want to point out is that from the beginning, the CSA was actually a mixed. We just heard about the ecosystem, the brain health ecosystem. So from the start, we had ministries and funders, we had research performing organizations, we had patient organizations, we had research performing organizations, we had infrastructures, we had advocacy leaders. So from the start, we had a bit of everything that was represented already. And we added, we had the help of the European Alliance for Social Sciences and Humanities because they had this unique expertise that we needed. So this is what it looks like. Don't worry, there's a lot going on, but I will guide you through it. So essentially, we started from those documents, and the first thing we did was produce a framework. So that was February 2024. And then we had a first draft. So we put all those things, like all the lessons from previous initiatives, all the national roadmaps, everything into a first draft that we wrote with the CSA partners. And then we entered a round of consultations. So we had consultations with the Scientific Advisory Board, and you will hear from Thomas Gasser a little bit later, who's in the audience. He was the chair of our SAB. We also had consultation with stakeholders, so professional association, industry representatives, and also, of course, feedback from the funders and from the European Commission. So all of this input was taken into account and injected into the SRIA. And that's what I'm going to show you right now. So we ended up with four major priorities and a bunch of transversal priorities. So the first priority, and we heard about that already a little bit, is the idea of promoting brain health and preventing brain disorders. So what does that mean? It means first identifying the determinants of brain health. And here I'm gonna just go right in and say, so right now you can say that fundamental science is already included, right? Because if you want to understand the determinants of brain health, you need fundamental biology. So this is what you see here. You have some example of what it can mean. We also want to prevent brain disorders with a lifespan perspective. So there's this idea that there's a trajectory in your brain health and that there are ways to affect it at many moments in life. So that is what we're trying to do here. So we're taking everything into account from development to aging. And we want to emphasize particularly effectiveness and citizens' empowerment. We also want to understand the effect of physical and societal environment because, of course, we're not in a void, right? So everything that's around us really affects our brain health. And we want to uncover mechanisms of compensation and resilience because, you know, given the volatile times that we're living through, this can be quite handy. So that's our priority number one. Priority number two is understanding the causalities of brain diseases, and that in turn would improve early recognition, advanced diagnosis, intervention, and treatment for people living with brain disorders. So again, understanding the origin of symptoms and syndromes, lots of mechanistics here. So again, something that's rather fundamental, and you have some examples also in figure. So we want to improve diagnosis by untangling multifactorial diseases and comorbidities. So this is something that's really important, especially if you look at aging, right? When you see somebody with Alzheimer's, usually they have so many other things going on, right? So you really need to understand what's doing what. We also want to understand prodromal to symptomatic progression because, of course, we want to pinpoint the therapeutic window. So if we don't know the progression of the disease, it's really difficult. We want to develop effective pharmacological, behavioral, and digital interventions. So again, that's really the heart of what we're trying to do. Identify biological and digital markers would help us on the 4 first points. And also improve disease stratification as a path towards tailored interventions. So it's something that was very big on the neurology side and now is really getting momentum on the psychiatry side too. So we think it's a perfect moment to have all those things happening together. Priority 3 is improving care and support for people living with brain conditions and their caregiver. And one of our main challenge, and we heard about it a little bit before also, is to translate research results into clinical practice. How do we do this? So it's, you know, we don't have a magic answer right now, but we want to look into it. And here you also have this idea that, you know, we're going to need a multi-stakeholder approach to reach that. So probably we'll reach out to some of you at some point or another. Be ready. We also want to understand the cost-benefit of early diagnosis and therapeutic interventions in the healthcare systems. And we want to consider acceptability in brain disorders and their therapies. Because if you have a drug that is amazing, but the patient cannot take it for any number of reasons, then it's useless, right? And of course, we want to disseminate good practices to increase participation of citizens in their health trajectories, because we think that it's going to be the best way for them to adhere to treatment later and to improve their quality of life. Last but not least, priority number 4 is integrating the social, ethical, and legal dimension to advance research and innovation for brain health. So we suggest to contribute to policy and practice by involving different kinds of stakeholders, right, to really advance things. We want to talk about equity in brain health. So this is something that is really important because, again, if you have a drug that is amazing, but not everyone has access to it, then that creates ethical problems. And we want to develop appropriate metrics to weigh the consequences of brain disease for patients and relatives and to evaluate the effectiveness of interventions. Because again, here, you know, something could be very good from a biological standpoint, but if it doesn't improve quality of life for the patient, maybe it's not enough. So, okay, don't freak out. It's a lot of text, I know, but I'm going to guide you through it, and I'll give you a sense of what the transversal priorities are for us. So one of them is to address the lack of science-based solution to create brain health-related innovations. So that's, we had a question about that a little earlier. And we want to increase the socioeconomic value in the brain space. And I think we have a panel just after that where Yolene, you're going to talk about what we intend to do. We want to optimize the use and sharing of existing resources and infrastructures. Of course, there has been a lot of money invested in those resources and infrastructures, so we want to really optimize this. We want to increase the reproducibility and the potential for joint exploitation of scientific outcomes, again, in the idea of making the best use of the money that has already been spent and reusing data that we have, because there's no use accumulating data. Better to just use it together and come together to make something meaningful. We want to rely on experiential knowledge and citizens' expectations for the design of research programs. So again, this goes in the same direction as what I told you before. We want to promote the systematic integration of ethical consideration in brain health research, and we think it's something that's really important because you're really touching an organ that defines who you are, your personality. So there are many, the moment you touch the brain, there are many ethical questions that happen automatically. And we want to influence the vision and practices of new generations of professionals in the field towards a more holistic consideration of brain function. So Ulrike told you before, there's a lot of training going on for young researchers, so we really want to push this moving forward so they don't do their research in a silo, but they think about brain health in an holistic manner. And we want to promote the appraisal of international and pan-European practices to develop powerful approaches to tailored interventions for brain health, and that would probably be in collaboration with the European Partnership on Personalized Medicine. So this is where we were, right? And what we decided to do was to put it to the tests, because this is what we had done with those consultations, but we really wanted to open it to the public and see what they thought about it. So this was done last summer by our colleagues at EBC. And you can see it was a very short period of time because we had no choice, but still we managed to have 560 respondents, which was quite a lot for a month. And the good thing was that it was not only individuals, but it was also organizations responding. So we are underestimating the number of people responding here. So this is just, data on age, gender. We were nearly at 50-50, which was, a good surprise. Stakeholder groups, you have researchers, you have medical professionals, you have some that are both also, and some organizations, some patient associations. Geographical distribution, so you can see we had answers from quite a large number of countries. And we asked those people to tell us whether they were satisfied or not with the priorities and what was in those priorities. And we had a good surprise to see that there was overall 84% of the community that was satisfied or very satisfied with the priorities of the 3R. So we thought it was good. There were a lot of comments. So we read all of them, and I wrote down a few here. So the need for additional fundamental research came back a lot. For animal models-based research and for brain-body research were things that, were really directly coming from the community. So we took that into account. So this is the 3R. You can see the beautiful cover that was designed by Gaël and Hugo. And you have a little QR code if you want to download it, if you haven't done so already. And just to let you know, so the partnership, so Ulrike showed you all the work packages, and basically the implementation on it of the partnership has been based on this agenda. So you have, an idea of the different activities that are going to take place, like improving translation of brain health innovation. And again, the next panel is going to be about that. Capacity building, collaboration, strategic alignment and dialogue. So you can see why we have EBC on board. Including and empowering patients and citizens, of course, something super important. Joint funding of research and innovation, so you already know. 2 calls in January, and you have the topics. And research infrastructures and data access, and Philippe will tell you all about it later. So that's it for me.
Would there be any questions for Catherine and any particular point? I see 1, 2 hands raised. Okay. Thomas, you're first.
Thank you very much. There's so much to applaud in the ambition of what you're covering. But it also strikes me as an enormous amount of objectives for 3 years and with this particular pot of money. And so I'm wondering how research grant applications are going to be prioritized. Do you envision this being proportioned to a distribution of different research topics that fit as many of your many objectives as possible? Or is it going to be more focused on scientific excellence, even if those proposals tend to co-localize into particular thematic areas? It will be topic first, so scientific excellence is secondary.
William, you had a question?
Yes, William Stevens of Tech Tour. I have 2 questions, but first an observation. So I saw that 50% of the respondents were research, and another 40% was, I forgot now, but anyway, my question was twofold, and it starts with the observation that in Europe, we're not behind on the US or on China on terms of public investment for research. We're behind in terms of private investment. So if you see how the US is being developing its R&D activities, it's a lot of private investment, and it's a lot of these very successful companies that are listed on stock markets, that are raising venture capital first, and they are investing a lot. So this is the big difference. So my question is twofold, really. Have you considered this community of startups, scale-ups, private investors to check, because they are working on, they're putting a lot of money behind the future. What is the research that will really make the difference in the future? That's the first question. Second question, we all know that these companies are not so often enticed by, I would call it, and please forgive me for this, with some of the bureaucracy and the slowness of these calls for proposals. So is the format of the calls, is it something that you studied? And could it be studied in the future to go forward so that actually we are more agile and more flexible to involve these companies? Okay. Even with lower levels of funding, by the way.
Okay,
Okay,
but
yeah.
you're not allowed to cut the grass on the Jolene's foot. So
Yeah,
go
no,
ahead.
I won't go into Jolene's territory. Just a quick, two points. So it's a public venture, this partnership, right? So that's kind of answers a little bit your first question. And then we have funders that can fund startups, right? Not all of us, but a lot of us can. So I can speak for ourselves. French startups can apply to those calls through us. So that's one way to do that. And then there's going to be 33 countries, so we have to stick to a timeline that works for everybody. At the national level, we have done that to be more agile. So for industry, we shorten the time because we know there needs to be super important that they can have this agility in terms of funding, but we cannot do that in those calls because we're not alone. At the national level, you can do it, but here what matters is more countries working together to maybe tackle a problem they wouldn't have been able to do so on their own, right? So it's a bit of a different mindset. I hope it answers your question.
Okay. Well, actually, I'm sorry, we will have to move on, but I invite you to take the questions during the panel discussion. And maybe on that occasion, Catherine, you will join us, or you will have the opportunity to then answer if the question is related to it, because we need to advance with the conversation. Yeah, you can shout if you like, but we are going ahead with the program because we are actually late. I'm really sorry, but please ask your question during the panel discussion because I'm pretty certain you will be interested also by what the panelists are going to bring up. So I'd like to invite on stage Jolene Rovers from the Flemish government, and Jolene is policy advisor at the Department for Work, Economy, Science, Innovation and Social Economy, and actually is going to certainly preempt some of the questions that you are having. We will have on stage Pavel Balabanov. Pavel is head of therapies for neurological and psychiatric disorders at the EMA, the European Medicines Agency. And we also have with us Jenny Young. Jenny is the executive director and coordinator of the Canadian Brain Research Strategy. So, Pavel, I'd like to bring you to the fore immediately on this discussion, because now we have entered really the nitty-gritty details of the content of the partnership. There were quite a few comments that you made when we prepared this session, and I'd like to hear from you as to the trajectory that the partnership is going to take, but also what you would welcome and what you would like to see flourishing thanks to the partnership from a regulatory perspective.
Oh, hello, everyone. Thank you for putting me in the spotlight. I thrive in it. For the ones that haven't met me, I am the head of the office at the European Medicines Agency dealing with neurology, psychiatry, and ophthalmology. So very much neuroscience oriented. My background is neurology. I was a clinical neurologist in my previous career. And to start with, one of the things that I would like to have more is also the reason that I'm here, is more presence of the European regulators in open discussions. So one of the things that I really think we have to publicize, speaking on behalf of the whole agency, is that we are really open to a dialogue by being present. And these dialogues do not have to be only on specific scientific topics. Of course, they should be on the scientific topics that we are always responsible for, but also in the broader context. And when we're preparing for this panel, I think that what we're seeing in each of our fields, in particular, can be translated as lessons learned many times to the other fields. And although our mandate will not be finance, or where to get the financing from, or what type of policy building we should enhance and focus more, we have all seen scenarios where we can learn from, and our partners across the field can actually learn from. So my main goal here, apart from being open to all of the questions, and you've seen some of you approach me in previous meetings as well, that I'm ready to answer particular questions and general ones. So being present as part of the stakeholder engagement is key. Because honestly, I feel that we're still not as frequently and as widely consulted as we should be. So my problem statement and my future-looking positive expectation would be to be more engaged, but not only by stating, oh, we are open for dialogue, but actually making the platforms that are available even now to interact with the regulators more well-known, practically well-known, what is required, what is the level of engagement we can provide for what type of questions. And to start a discussion maybe from our side, I would ask anyone to actually tell me why are you not contacting the regulators? Because if we're talking about finance, if we're talking about calls for certain specific projects, there's, you know, we know the requirements are high and there's money involved and there's investment. I would argue that quite a few of those are not as requiring when we're talking about the regulatory interaction. And we've seen a lot of projects that progress further and further without even consulted on a basic level with the decision makers. So I'm here mainly to promote the fact that you should talk to regulators. In my opinion, any publicly funded or partially publicly funded project in the area of mental health and new drug discovery should have a regulatory interaction platform built in so you don't miss out. My last statement, and I stop hogging the microphone, is that if you contact the regulators, the immediate benefit is you save a lot of resource. By cutting off the clearly unacceptable or the clearly no-go decisions from your decision tree. Stop here.
Well, I mean, we're so glad to hear you say that because actually we were looking forward to having regulators, you know, coming, you know, with us and responding to the invitation. So thanks for coming again this year to the BIDs and particularly to the final conference. Jolene, we heard from Ulrike about the structure and the integrative activities of the upcoming partnership. We heard about Catherine from the content and the agenda. You will have dedicated responsibilities in those work packages and very interesting infrastructure. So now we can come and, sorry, I wanted to deep dive on the scene setting before we can advance the conversation. And I believe that you can share with us a vision as to what the integrative activities are looking like for those you are responsible of, and we'll hear later on about others. But so this principle of bringing stakeholders together to serve the community, but to also accelerate innovation, engage dialogue with regulators and others. Where would you like to start? And I would say there is so much to be talked about. Yeah, where would you like to lead us?
Thank you for this introduction. And indeed, I'm very happy with all the questions already received. I see there's a lot of interest in also the innovation aspects that we plan to do within EP BrainHealth. And I'll maybe just give a brief overview of what we have envisioned to do. So I can structure it among three main things that we plan to do. So first one is identify the needs that we collect from the researchers and the brain health community, the patients, the healthcare practitioners, I'm sorry for that, to see what kind of innovation needs are existing. And then we will complement it by also identifying already existing tools, because like you mentioned, several things are already existing and available. And then we try to match this, make this very easily available, create an innovation toolkit that is present on the website, and organize summer schools also not only for junior researchers, but also more senior people that maybe already have something that they can bring further towards innovation and implementation. So that's one. And then the second thing that we want to do is connecting people. So bringing people together along the innovation trajectory, organizing hackathons, creating matchmaking events, making sure that people that would like to go towards this innovation trajectory, that they can find the right people that can accompany them and guide them. Also showcasing best practices and making sure that all kind of activities are well known within these communities. And then, of course, another important part is the accelerating and the accompanying the researchers in this trajectory. We will do strategic advising activities where we match people or researchers with people from industry or with an entrepreneurial discovery tract where they can learn and be mentored in how to bring their inventions further into implementation. And then already Ulrike mentioned it, there will be 2 calls with innovation, with industry, where we will focus really on these industry aspects, even though Catherine mentioned already in every JTC call, there are funding agencies present that also can support SMEs or startups, for example. And then lastly, we want to work on the frameworks, the enabling frameworks, and also connect with the regulatory agencies, make sure that this communication is twofold. So I'm very happy that you mentioned before how you will, how you want to reach out to us, because we as well would like to have this structured way of communicating and disseminating what is happening towards the researchers, and vice versa, communicate their additional needs to you. So that's it for
okay,
now.
Thanks a lot. And quite a few points led on our conversation or on our table to pick up upon in the course of the discussion. Before we get that, Jenny, I'd like to invite you to take the floor. You've made a long way to be here, so we are very appreciative of your participation. So you have founded and initiated the Canadian Brain Research Strategy. Can you tell us more about the process and what it is exactly, but also in the spirit of the international collaboration that the partnership is bearing and the potential that it is bearing, what could be ideas or trajectories of collaboration for the future?
Thank you, Fred, and thank you for inviting me. It's a thrill to be here. I think research is facing challenges around the world right now, and this kind of collaboration can hopefully convince our governments that our work is important. So I really enjoyed listening to Catherine talk about the SRIA, because there's a lot of parallels with what we have been doing in Canada. So we've been leading the development of Canada's first national research strategy for brain and mental health. And it's really founded on the future of what our early career researchers saw. But we have the heads of 40 neuroscience and research institutes and around 40 other organizations, health charities, patient groups, nonprofits, private foundations, and also very important to Canada is that we engage Indigenous knowledges as well. So we built this national strategy, and it's really centered around 3 principles of open science, collaboration, and transdisciplinary work, and this is building on our existing strengths in Canada. And so there's a lot of parallels with how research has been fostered in Europe as well through the Human Brain Project and others. And the transdisciplinary aspect is what is so great to be here with my fellow panelists, because it is more than just basic discovery research. And it's the recognition that we have to train people, that we have to put in resources, in infrastructure, and coordination to actually build this up. We can't just expect this to happen naturally. And so that means collaboration with regulatory bodies, and also collaboration to consider the ethical, legal, social impacts of research. And that's because we know that brain health impacts all areas of society. And this was actually the point, we were the national convener with many collaborators of the G7 Canada Brain Economy Summit this past summer. And this was trying to leverage the fact that Canada has the G7 presidency right now, and we can take the lead, and France will have it next, and we are passing on our work to them. But the gist of it is that, in addition to this recognition that we have to widen the tent more for research, for brain research to have impact, we can actually bring that even beyond to larger, broader areas of society. And in fact, it highlighted people from business, from labor, from think tanks, from many sectors of society that have been working to promote brain health using the knowledge that we have generated from research. And so this is both how we hope to make brain health and research a more relevant issue, especially right now when there's so many other challenges in the world. But it also highlighted the work that we're already doing, so that we're not just going to governments and saying, oh, we need this and we need that. And it's, again, the recognition of that need for coordination, but this time on an even broader scale.
But you would say, and you would compare the work you've initiated to what the partnership is looking like, with a dedicated agenda, priorities, engagement of different partners. Obviously, you have also a federal system in Canada with the provinces having a great deal of responsibility in the strategy. So how did you combine all those forces? And I'm tempted to ask, is it working?
Yes, well, so first about how we brought everyone together, and that was through a large numbers of consultation series, similar to creation of the SRIA, so that even though we came on these principles that is very common, everybody feels like they have a stake in it and they can see where they belong. And now, of course, we want to continue that process by bringing in other sectors like regulatory and so forth. The provinces, it is very interesting. We have a federated health system in Canada. You know, some of the common needs that have come up is data sharing and so forth, and we always use the EU as an example, because in Canada we're complaining about trying to cross provincial boundaries and 2 languages, and of course it's a much more complex situation in Europe, and you have successes to show that it is possible.
So there was definitely a mutual learning. I would like to ask Jolene, Pavel, could that be a source of inspiration to look maybe a little bit north rather than in our transatlantic collaboration with Canadians, and how you would see that this can serve the purpose of different activities? And I don't know, Pavel, are there any exchange of experience, knowledge from regulatory agencies?
Yes, of course, and we keep in touch not only with Health Canada, with FDA, with the Japanese authorities, with the Australian, to mention a few. We are very much in touch with the Swiss as well authority, and any regulatory authority that wishes to do so on a regular or less regular basis. What we try to align, of course, apart from the scientific practices, which are, I have to say, much easier to align than the regulatory practices, because we are governed in different models. But we also try to not put the patients and healthcare in a situation where something, for whatever reason, legal or other, is actually providing different context across the different regions. So a drug available versus not available, purely for differences in regulatory system rather than science. That's the main point of alignment, because, as I say, scientifically, I think that this is much easier achieved. Science is now global, and there's rarely this discrepant position on scientific topics. What we also learn, of course, from such attempts is how to communicate and how to interact with multiple stakeholders. And I think that this would be extremely useful. I think the comments on the previous lecture, that when you have multiple stakeholders and multiple goals, there's a balance between inclusiveness and achieving the different goals with the different stakeholders. To me, the solution is not simple, but I would describe it as something like targeted inclusiveness. From our perspective, I can say in the things that the European Medicines Agency have the mandate to be involved in, we have to be involved. But this doesn't mean that people and stakeholders should wait until the moment they actually reach the regulatory state to actually start contacting the regulator. A much more prudent approach would be to get the involvement as early as possible, and then at certain points where we know and we foresee that regulatory activities are becoming crucial, important, to actually target it, push the respective stakeholders, say, okay, now we're moving towards this and this decision where you have a more prominent role. This combination of knowing early enough about something that is requiring an intervention and targeting the involvement is a combination that I think works. Otherwise, all of you have been parts of different platforms and different fora, and you see the 30-minute meetings within the year, and you do not have a concrete output. This is the fatigue that all of us try to escape from. And so very practically, when we have to be involved, please do involve it, but also continue thinking about early engagement, even though for a while we may be just listeners and advisors rather than being active. So that's something we've seen also with international partners. We sit on different fora and we listen to each other, not necessarily expected to be active at the same time.
Thank you. Jolene, I saw you nodding on a couple of occasions. Any comments you'd like to share with us?
I just wanted to mention that indeed also from... Oh, thank you. Is this better? Yes. Also from AB BrainHealth's perspective, and at least from my perspective, we would definitely welcome any interaction and collaboration and peer learning among ourselves. I mentioned before the innovation toolkit. I think that would be a great opportunity because we want to identify what exists globally and not only within the countries that are part of the partnership, of course. So I think that would be a perfect opportunity to collaborate as well.
I have to steal it away because this one has that.
I just wanted to add to Julian's comment because we have to admit, so of course innovation is a big part of our strategy, but it's embarrassing to admit that it is a place that we really could do better in Canada. So we have very low investment in R&D in Canada. In fact, we are the second lowest of the G7. And although Italy has been moving upwards, and but when you break it down, our government investment is decent. Of course, I'm not going to tell them that, but it's really business and private sector investment and research that is lacking, and it's something that we really hope to learn from Europe. These partnerships. And we have some great efforts going on in Canada, and our national strategy is meant to amplify that. So I believe my colleagues from the Ontario Brain Institute are here. They have a fantastic program in innovation as just one example that we can build on, but looking forward to working together.
You had a comment? No?
I have a small comment. It is really in those public-private partnerships where also public money are being spent that we should not allow ourselves to be caught in a situation where the regulators are necessary but not involved. I think we've seen quite a few examples where, you know, enthusiastic, knowledgeable people progress and the science is there, and when they arrive, they're just not ready for what the system requires. And this may be bureaucracy, it may be hard to understand or to agree with, but it's necessary. So especially think about funding, and you've secured the funding, you've secured the scientific input. It's a small step also to include the relevant regulator in order to prevent delays and even more spending so that's my message. Thank you.
I'd like to turn to the audience for questions, and I'm coming immediately to you with a word of apology, but I promised you could ask a question.
It was not a question, it was more referring on the quality on the data. One of the things is that Europe is more ahead on the data developments than the Americans. That means strange because they will look all to the big tech. But in Europe, we are more focused on quality on the data, on the research on the data, and we are far ahead. And the GDPR is the most interesting part, that you had the quality of the data and the citizens' trust. And that's one of the things that nobody had to recognize. The lady before us mentioned it also, that you need the society with you.
Okay, but that's a question we'll certainly come back to in the next panel as well, because we will discuss data sharing in a moment as well. Another question. Think about an answer. I'll take 3 questions and then we'll come to it.
Yeah, it was also a little bit related to the structure of the partnership, because there will be funding in the partnership to research projects and implementation projects, as I understand. But how do you also align with all the other fundings that exist in the European landscape? Because we have the Innovative Medicine Initiative, where there actually could be funded projects of brain health, and in the Erasmus Plus on capacity building. And how is it something that you also discuss and do strategically? So it was a question.
Okay, so we'll have an answer by Ulrike. It's not working, unfortunately. I'll take a. Okay, you want to answer to
I can directly answer if you want. So the way it's being aligned, it's by a long way of how we publish the calls. You will see the title of the call, and then we will see exception A, B, C, D, E, F, G. And basically, the calls are framed in such a way that they are not overlapping with IHI, for example, or with Erasmus or whatsoever, because the funders are not interested in. So it's being shaped in such a way that there is usually no overlap, or if there is an overlap, it's just in a way that it's not in the same year. So there might be, let's call it, for example, for rare diseases, there might be calls which are not indication related. So there might be neurological rare diseases in there, but then it's about diagnosis only. And you've seen the type of call titles we have. So this is really, really very tightly shaped, the calls, and there is usually no overlap. Or if there is one, it's very tiny, just for certain countries, regions, or let's say for some very small indications. But it's a very broad topic here, there. But then you see in the call text all the exceptions in there.
I can also answer that briefly for our national strategy. So funding organizations have been a very important stakeholder group that we engaged in building our strategy. And it's because we brought them on board not to fund the BRAIN initiative that we need, but to amplify the impact of the grants that they are already supporting. So for example, a lot of them have been funding open data sets, but they sit in isolation, and it shouldn't be up to that organization to make sure it connects with others. And there's a lot of researchers that want to contribute or use that data, but again, being supported solely on a grant basis is not enough. And the same goes for training. There are training programs in various transdisciplinary aspects across the country, funded by various programs. And so the gist of what we're asking for is really stable, long-term, non-grant specific funding. And this is something our government has done for competitive reasons in AI and quantum technologies, and we're asking them to do the same in BRAIN. Especially in Canada, and I'm not sure if it's the situation in Europe, our grants are so small that we can't support research staff, for example. And we need those kinds of positions. We need to scale up the existing training programs that we have and just make it accessible. We don't have to duplicate the wheel or replicate everything everywhere.
Okay, my question is based on the keynote.
Please introduce yourself. You will be
okay.
introduced in a minute. But,
Yeah, Damien Eke, African Brain Data Network, and IBI. My question is based on the keynote and some of the discussions that we have had. Do you think it's necessary to engage with or collaborate with countries and regions that are not part of the partnership? If the answer is yes, how do you want to do that in terms of bringing in countries and regions that are not part of the partnership?
Ulrike, is it back to you?
So yes, it is. That's a short answer. A little bit longer. I mean, you have seen already there are already some third countries, non-European countries. The point there is it's a European legal framework. We have mentioned GDPR already as a way to create trust. Yeah, but that means also that the third countries need to be able to join that kind of legal framework. For example, sign all the paperwork we need to exchange data, and also to align the way we do funding, the way we do publish the calls, how we evaluate the calls, how we do the funding, timely in the way of the timing, in the way we allocate budget. So yes, there it is, and we are reaching out. We first have to build the core with the ones which are already used to this kind of collaboration. There's no wonder why it's New Zealand or Canada in there, for example. Because they are long-standing partners already with other European frameworks, projects, and also networks. So that is easier, let's put it like this. But we have seen it also with other European partnerships. There are third countries which are in there, and we will reach out and try to prepare and pave the way with this kind of collaboration. And there might be other ways to collaborate, be it by capacity building, be it by exchange of structures and information there, but there might be also aligned funding as a possibility to do so.
Thank you, Ulrike. And I know you didn't receive many questions, but I still would like to invite you to provide a word of conclusion of this panel as we are getting to the end of it. And I don't know who would like to get started. Jolene, okay. Yes? Yeah, you feel like it?
Yeah.
Off you go.
So I just want to reiterate that the AP BrainHealth partnership, although it is research that it also has an important aspect of innovation that we want to address, and that we are very open to collaborate also beyond the partnerships to achieve this.
Thank you.
From me, we have a platform. If you don't know about it, it's called the Innovation Task Force. And this is a platform that if you do not know, you should get to know, because it's available for anyone wanting to discuss innovation with the European Medicines Agency. It is a free platform, and it gives you a direct access to experts in the field who share their position for anything that is classified as an innovation, and for that we are quite open. So do not think only about the big breakthroughs that everybody is buzzing about, but even things like discussing an adaptive design trial or use of real-world evidence in a field which hasn't been done before can be considered as innovative approaches to be discussed. This is one of our early access platforms. As I said, it is free of charge. It does not require a lot of investment, and I think it should be more used to steer the development and the innovation in science and in healthcare. So please come to us and talk.
Thank you. Jenny?
I just wanted to, I guess, close on just how thrilled I am to be here, because we all want to work together, and I can see the kind of impact of that already. And the first time I came to Brussels was when EBC invited me to their first Global Partnerships in Brain Health conversations. And I think not only is there room for us to collaborate on research, on regulatory processes and care processes, but also in advocacy. And for example, in Canada, if we say, oh, well, another country is doing this and we need to stay competitive, that always has impact as well. So there's a lot of opportunity to work together, and I'm thrilled to be here.
Well, thank you very much. And please, a round of applause to thank our panelists. And so we are going to close session number 2 and move to our third keynote. And as promised, Damien, it's your moment of glory. So Damien Eke, to provide us with the introduction to our third topic on how to overcome global barriers to data sharing. So Damien, you're the co-lead of Data Centers and Sharing Working Group at the International Brain Initiative, and as you said, director of the African Brain Data Network. Over to you.
Thank you. And thank you very much for inviting me. Now, maybe a lot of people will understand why I asked the question earlier. If we're going to talk about global barriers to data sharing, then we have to understand why we need to collaborate. So this is an important topic because, as we all know, maybe I'm preaching to the choir here, data is at the heart of everything that we do, both for research and innovation. And it is important for us to share data because the understanding or effective understanding of the brain, its diseases, and how it functions requires all of us. It would take a village to understand the brain. Not one region, not 2 regions of the world will provide sufficient data to understand the whole brain. So it requires all of us. And that's why we're going to talk about global barriers to data sharing. There's an assumption here that there are barriers to global data sharing. And in this discussion, in this presentation, we're going to see what are those barriers and how can we address them. But before that, there is another critical question. We're talking about brain data. What is brain data? If you look at the A part of this image, maybe you're all familiar with this Churchland paper describing neuroscience data. But in the age of AI and digital technology, the meaning of data has moved beyond raw measurements to other things. Now we can use raw data to generate derived data, create models, and also have software metadata. So Brain data does not just mean the raw measurements again. It moves beyond that to include both derived data and also software and metadata. So brain data, whether it is raw data, derived data, software or metadata, will refer to any data that describe the structure, activity, function, or health of the brain. So that is what we are referring to here. So the global brain data sharing matters, and that was what I was talking about earlier, because brain health challenges are global, and therefore it requires global collaboration. And this is something that we have to bear in mind always, because data within the globe, effective data sharing helps us to improve scientific discovery and innovation. That is something we all have heard all day. And also improve reproducibility. We can achieve the level of reproducibility that we want in neuroscience without brain data sharing. And also generalizability of results. If we do not have sufficient diversity of data, the therapies that we develop with our data, the outcomes of our research might not be generalizable to a lot of population where the data sets are lacking. And also, it will help us to improve brain health outcomes. But as we all know, brain data is one of the most sensitive forms of data. Therefore, it raises both ethical, legal, technical, and also social or political issues or concerns. And that is how we're going to frame or identify some of these challenges or barriers. So there are legal challenges, there are ethical challenges, there are technical and also social political challenges. So some of the ethical challenges also include emerging fears of data colonialism. So most countries in the global majority, that is a common issue that you find, that people are scared of what they term data colonialism. That is the exploitation of data sets from these regions without giving them equal benefits for the data. And also bias and discrimination. This is maybe one that we all are familiar with. And also lack of ethical guidelines for novel uses, especially with AI. We do not have sufficient ethical guidelines on how to use data, especially when it involves AI. And that prevents sharing. And also potential misuse or dual use of these data sets. And these are issues I've experienced when I talk to researchers across the globe, whether it is in Europe, whether it is in Africa. I'm going to maybe make reference to it later on. Even in the UK, recently there was a public news that now Chinese researchers have access to the UK Biobank. And there were a lot of mixed reactions, especially in the media. So there is always fear of potential misuse or dual use, which prevents sharing. And also, there are legal barriers that we encounter in sharing. Fragmented landscape of data protection regulation. Now, with the GDPR, establishment of the GDPR, most countries and regions now have their data protection regulation frameworks, which might be slightly different from the GDPR. So there is a fragmented landscape of data protection regulations, which means that data moving across boundaries, difficult these days. We usually, in fact, a few years ago with the GDPR, researchers thought that GDPR was preventing sharing. But think about most data localization policies happening in most parts of the world, which are actually preventing data moving across borders, irrespective of any legal basis for processing the data. And then also lack of clarity on the legal classification of brain data. How to classify brain data. Is it sensitive data? Is it not sensitive data? And also in the face of increasing risk of re-identifiability of what we used to term anonymized images that we now know as pseudonymized images. I'm talking about maybe defaced MRI or fMRI. Years ago, we classified it as anonymous data, and now moving beyond the provisions of the GDPR, but now it is not. Or even as at now, even though we term it in Europe as pseudonymized data, and therefore is subject to the provisions of the GDPR, in some other countries, maybe in the US, it's still de-identified data, and it's maybe beyond the provisions of HIPAA. So, and also cross-border transfer restrictions. I was talking about data localization policies earlier. If you analyze most of the data protection regulation happening in Africa, there are clear data localization policies where data sets are prevented, especially if it involves health, which is what we are talking about here, cannot be allowed to move beyond boundaries. So it is a legal barrier there. And also lack of clarity on ownership of brain data. Who owns data? In Europe, the GDPR can provide a framework for us to understand ownership of the data. Because if it is still personal data, we cannot own it. We can control it, but we cannot own it. But it's not as clear in some other countries. And also, I think we heard about that earlier. When it involves AI, when it involves commercial or industry partners, who owns the data is important. And there is legal uncertainty or maybe lack of clarity on ownership of brain data, which also prevents sharing. And then there are technical barriers to sharing also. Lack of technical skills to collect, process, or share data. We live in Europe where maybe data generation it's common in research institutions, in the industry. In most parts of the world, maybe in the global majority, researchers still lack the skills, the technical skills to collect, to process, and to get the data sets ready for sharing. Most of the data sets that are available in the global majority are maybe unstructured data or data sets that cannot be shared for research use. So that also prevents sharing, and also lack of infrastructure. But infrastructure for storing the data, infrastructure for making the data sets available for use. So, and that also prevents data sharing. And limited interoperability of available infrastructure. In Europe and America, and also in Asia now, there is an emerging landscape of digital repositories for brain data. But most of these repositories are still not interoperable. So, and which prevents sharing also, and metadata standardization. We're happy that BEATS is doing wonders for neuroimaging, MRI, fMRI, but then most brain data sets still do not have formal metadata standards for sharing. So that also prevents sharing. And then there's also socio-political barriers to sharing. I remember a few years ago when we were setting up the access mechanism for eBrains, we had to also look at the list of banned countries, the EU banned countries for accessing digital infrastructure. That's a political situation there that prevents sharing to those countries. And also for most countries, the historical mistrust and evident power imbalance between these countries prevent sharing. And then lack of motivation and incentives. Maybe if we say by a show of hands, most people that are not sharing within the room because they feel that there is no motivation or incentive to share. And that is a common reason that I find in Europe when I talk to people, researchers in Europe. There's still lack of motivation and incentives to share. And also sociocultural perceptions. I was referring to this earlier on when it was made public that Chinese researchers now can access the NHS UK Biobank. And this is one of the news items or maybe that actually popped up from the Daily Telegraph, that China could now use the NHS data to develop targeted bioweapon. That's a fear of dual use there. So these sociocultural perceptions can also prevent sharing. But then what do? What we want to do is or what we need to do is to move from these national data protectionist laws to a global ecosystem where we can all share our data sets, all benefit from data sets from across the world. And also, which reduces cost for research. I know we've been talking about funding, but that will reduce cost of research if we all share our data sets, but we are still not sharing. I must say, neuroscience is improving. We're improving in terms of sharing, but I don't think we have got there yet in terms of what we need, how we need to share and what we need to share. So we need an effective international data governance framework that allows researchers to see all these not as burdens, but as enablers to research, where we can all understand what we need to do and then do research and not feel as if we are being overburdened by these regulations. So how do we do that? I think the first thing that we need to focus on is how to harmonize and align regulatory frameworks, even within Europe. The GDPR is not the only legal framework that will interact with us researchers. Now we have to also interact with the DSA, we have to interact with the EU AI Act, we have to interact with other data-related regulations within the EU. But we need a harmonization process where we can all understand what we need to do so that we don't run around thinking about what do we do with the EU AI Act, what do we do with now the health data space regulation also. And then capacity building, it's important. We need to train enough people within our region and also outside of our region to collect, to process, and also to share data. It will not be effective for us to develop all the digital infrastructures, all the data sets that set all these things up, and we don't have people to use them. We need to train people on how to collect data, how to use even the systems that we develop. And then maybe have brain data specific legal standards or clarifications. And this is a talk beyond the neuro rights movement, no. But specific regulations that can clarify, or maybe here the genetic data has a special place in data protection regulations. Maybe we can advocate for having a specific or special treatment for brain data in this regulation so that they're very clear to researchers or to people in the industry. And then provide fair benefit sharing frameworks. I don't know whether we are all familiar with the CARE principles for indigenous data. Years ago, some indigenous people came together to discuss data sovereignty, to understand, to set up a data governance framework that moves beyond fair to address the issues of equal benefits. So maybe developing better fair benefit sharing frameworks will be important for us to understand how to encourage people to share their data. And also, maybe bring in people with lived experiences for them to understand the purposes of sharing and why we need to share. Because if they don't understand it from the beginning, that also might prevent sharing. There is also an emerging landscape of initiatives trying to solve these problems. Maybe we're all familiar with dynamic and tiered consent models. The open brain consent is something that maybe we have interacted with. And also maybe developing privacy-preserving technologies that will federated and privacy-preserving technologies for data infrastructures will be one aspect of addressing this, so that people are reassured that there is some level of acceptable security to the data for them to share their data. Homomorphic encryption might be there, or federated learning infrastructures. but also regional and international data governance alliances. Global Brain Consortium is the bridge, is a project that Wellcome Trust is funding to develop an international framework for brain data governance. And also OECD, or maybe regional initiative like ours, which is African Brain Data Network. It's something that we need to do to make sure that we understand what regional perspectives or regional values and principles that will lead to a responsible data governance framework. And also, or maybe developing enough platforms for data visitation so that the data sets will not move from one region to the other or from one country to the other, but we can all have access to it without having the problems of moving the data from one country to the other. And then maybe think about community-led governance or participatory ethics boards in our projects. I wonder if the partnership has that. It's something that assures both patient groups and the communities that their voices are being heard. Their voices are also informing the data governance framework that you adopt. So these are some of the initiatives that are emerging in the landscape to address these barriers. But I think the responsibility is on all of us to understand our responsibilities to the patients, responsibilities to the society, to understand that we need to protect their rights, protect their privacy, and also we have an ethical responsibility to also move science forward. And to do that, we need a responsible data governance framework. Thank you.
Thank you very much, Damien. And you stay actually with us for the panel discussion, so grab a seat. And I'd like to invite on stage Philippe Vernier, the joint CEO of eBrains, Mahmoud Bouka Maina, who is Wellcome Trust Career Development Fellow at the Yobe State University in Nigeria, as well as the University of Sussex, and Anthony Hannan, who is the co-chair of the International Brain Initiative, but coming all the way from Australia and representing also the Australian Brain Alliance. So make yourself comfortable. Welcome. It's a pleasure to have you. And Mahmoud, it's a long time. But it's a pleasure to have you, and I've got the feeling we are continuing the opportunity we had to interact on Thursday last week. With our third webinar. It's actually the same crowd, and maybe we can deep dive in the conversation we actually started there. Mahmoud, I'd like to bring you in maybe, because we discuss on multiple occasions this issue of data sharing, also when you were involved with the Society of Neuroscience in Africa. And there was a very important element that you and I discussed, I remember, on the issue of diversity, and what in Africa in particular you were considering as so important in this capacity to exchange data, and probably you can incorporate some of the elements Damien was sharing with us a minute ago.
Thank you very much for having me. I woke up this morning around 5 a.m., but I couldn't come here until 3 p.m. due to problems from Brighton. But yes.
But we had a strike yesterday, and it's a miracle the meeting is holding together. So I can tell you, we had a bit of white hair and nightmares, but it's going fine, and we're glad you're here.
Thank you. I think one thing that perhaps is very important to even highlight while Damien was speaking is the fact that when we talk about these data sharing frameworks and methodologies, and we talk about Africa, is the data even available? And this is a very important question, not because I'm from Africa or, and I have family there, but because it is important for the global science. And I like to give example always, just like Damien was saying, to solve the brain problem, it needs an entire village. But someone could argue that, okay, who cares? But maybe we are just doing our own things in Europe or in America, and that should address all the problems that we have. But then that's really a misconception and a problem that the brain community needs to address. So 2 examples. One has to do with, let's say, cystic fibrosis. Cystic fibrosis is a disease that up to date is being taught as a white only disease, because most of the variants that are associated with that condition are kind of overrepresented in the European population. So even in America today, someone from a black background might go to the hospital and get failed diagnosis because most of the diagnostic kits do not capture those variants that are perhaps more presented in the African population. But then you could argue that that is for Africans. How about we Europeans? Does that matter? But then again, in the case of dementia, for example, we know that the biggest genetic risk factor for Alzheimer's disease, for example, is ApoE4. But then in African population, ApoE4 is not really a risk factor for developing Alzheimer's. So I like to argue that maybe to solve that problem, you need to study the African brain or the African people. So therefore, the data is really not existing in Africa, and there is therefore a big argument where researchers from both ends of the world need to work together to enhance awareness about why that is important, build capacity, and also kind of help in kind of ensuring those areas that don't have good data sharing frameworks are able to develop them so that there will be good data sharing across the border.
Thank you, Mahmoud. Tony, I'd like to turn to you, because obviously Damien was sharing in part of the initiatives led by IBI, but there is probably more that you would like to add to it, but also maybe reflect as to some of those issues are, you're facing those issues back in Australia, and how you have overcome those, because you were also sharing last week some specific features having indigenous people and brain data about indigenous populations. So how do you relate to it back in Australia, but also how IBI is trying to address those issues?
Great, thank you very much, Fred, and thank you to the other organisers. It's great to be here. So to introduce the International Brain Initiative, or IBI, it really followed from the brain initiatives led by the European Human Brain Project, which has morphed into eBrains now, and then followed by brain initiatives in North America, in Asia. And the idea was that the IBI could bring them together and really enhance collaboration, but enhance data sharing globally. And Damien gave a beautiful outline of that, including with the IBI working group on data, which he now co-leads. So that's a very big aspect. And just in the last year, Judy Illes, the chair, and I'm co-chairing, we've brought in the African Brain Research Initiative and LatBrain, the Latin American, so making it truly global. So there's a lot of remaining issues. We are interested in education and outreach because ultimately the future of neuroscience is in research students, in postdocs, in the early career researchers. We need to ensure that we really build the future of global neuroscience. We have a neuroethics working group, which is very important, as we've heard today, and we have a cross-cultural working group that had this, many will have seen this Nature paper early in the year about the cross-cultural aspects of neuroscience, and that touches on, there was an Australian member on that, and Canada, led by Judy Illes and others. So I wanted to focus on what we've heard today, which has included this extraordinary numbers around approximately 4 billion people, so almost half the planet has at least one neurological or psychiatric disorder. And my own research interests at the Florey Institute include epigenetic inheritance and the developmental origins of mental health and disorders, or DOMHAD. The implications of that with radically changing environmental exposures and lifestyle factors is that this is going to get higher. These are intergenerationally, there's evidence now that some of these disorders, particularly brain disorders, are going to increase. And we heard about existential crisis. I think this really is a potential existential crisis, and therefore I think there's just enormous urgency on really every country getting bang for its buck from their neuroscience investment, and that's partly what IBI is about, avoiding data wastage, maximising usage by global sharing. And we've also heard about competition between countries and regions. I think we should also be thinking about collaboration, not be viewing other countries and regions always as competitors, but viewing them in this day and age as collaborators. We're all humans. Brain disorders do not respect borders. They don't care what country you're in. They don't care what side of the planet you're in. And I think ultimately, I'm starting to view this health crisis, which is getting worse because of the way humans have changed, environmental exposures and lifestyle factors, as potentially being as threatening as climate change. But climate change is affecting all 10 million species on the planet. This is really affecting one species, humans. So the big picture there is that through the International Brain Initiative, we're hoping that we can accelerate understanding of the brain and hence accelerate enhancement of brain health.
Thank you. Philippe, I'd like to turn to you as joint CEO of eBrains. You will be deeply involved in the work package on data infrastructures in the upcoming partnership. But hearing from colleagues on the panel and maybe reflecting from last week and moving ahead, so where do you see those issues being integrated, taken into consideration, and what sort of solution can we try and develop?
Thank you, Fred. Again, I'm very happy to be here, and I would like to congratulate Damien for the really comprehensive and nice presentation you made, because I think you set up the stage very well, and also for your beautiful plea for data sharing worldwide. I think everybody is convinced now we should do that. So now how we can do this? In the European partnership, I think what we have planned to do, basically, because you see the challenges are tremendous. Of course, the outcome are also extremely appealing. It's really worth working on this for not only for the sake of humanity, but also because we need now, as it has been put forward several times this morning and this afternoon, that we need this data to get the best out of AIs. Sorry, notably for national models, we don't have yet really. So what we badly need now is not to tackle all these major issues at the same time. I think it would be impossible, but to try to set a path. And what we would like to do in the European partnership is first to embark the other research infrastructure, not only eBrains, which is mostly involved in data sharing, data atlasing, and using modeling tools, but also the other infrastructures which are gathering data, for example, in biobanks, like in BBMRI, in omics, like in Elixir, for example, or brain imaging in general in Eurobioimaging, and so we also have animal models in infra-frontiers. So we have all these infrastructures in Europe which can provide part of the pieces of puzzles which needs to be put together for brain health. And what we would like to do is to set up first a roadmap for data sharing. I think it's because Damien has beautifully said what we need to do, but now we need to do it put it in practice, and we have seen all the hurdles we need to pass. Second things, this has been already underlined by a few of you, by some of you. We need trainings, because in fact all these methods, this new approach of science is not shared at the level we would love to have it yet. So there is a lot to do in terms of training at all levels, not only students, but also researchers themselves, also patients, also the society itself. So I think it's a second pillar we need to build in. And then the third one, I think we would like to develop in the European partnership is also, because you have seen the complexity, so we need to set up, I would say, a few use cases, because this will make things more concrete and will allow, to see how we can try to solve some of the problems we have been heard from Damien or yourself. So we need to set up a couple of very good use cases, also to show that we can share the knowledge and data between infrastructures, because of course eBrains is not the only one. And we need to do that. And again, there is a large fragmentation, but again, to try to solve all this problem, use cases seems to us the best way of trying to solve it in a very practical fashion, not waiting for years before we have the beautiful European health data space, which is a great idea, but we will be a bit long to implement, for example.
But you say use cases, does it mean pilots, or you think of something different?
I mean, we have heard, for example, that there is there is a major need for biomarkers in many diseases, like, of course, let's speak about Parkinson's disease, both in Africa, in Latin America, North America, Europe. So for this, we need to put together the data, from different, the clinical data from the patients, the imaging data, with all the modalities we can use now, the omics. All these interoperability questions needs to be solved. And they are not solved yet. So I think setting up a project, on a specific disease, for example, by which we can gather data from the infrastructures from different countries, this already would allow us to really tackle the problem in a very practical way and to see how we can solve them and then show also to the stakeholders, to the government, that it's the best way to do, the best way to go. That's, I think, what we have in mind by these use cases.
Okay, thank you. Damien, we'll open the floor for questions. We have one already there, but before that, Damien and Mahmoud, I'd like to hear your reflections, because I saw you nodding and wishing to react on what Philippe and Anthony was saying. But Damien, more specifically, I heard from your presentation the proposal on training. So that's probably one of the 3 solutions already incorporated. But how about the roadmap and the use cases?
I love it because one of the things that we're doing as Bridge, I think I mentioned Bridge project earlier, funded by Wellcome Trust, is what we have called Pathfinder cases. So we are going to all parts of the world, to Dubai, to Latin America, to Asia, Africa, Europe, and the North America, to identify specific data sets and try to move them across borders. Let's say somebody from Africa trying to move the data set from North America to Africa, or maybe somebody from Latin America trying to move the data from Europe to Latin America. So that way we identify practical barriers to data sharing and then develop pathways to addressing them. So I love the idea of use cases, but just to say that if the use cases are not just located in Europe, then it will be good. If it's all located in Europe, we'll all be dealing with the GDPR without interaction with the other data protection regulations that can also prevent sharing. But use cases are very, very, very important in identifying practical barriers to data sharing.
Thank you. Mahmoud, you also had a reaction?
Yeah, I like the idea. The only problem I think that I see is, especially when talking about biobanks, because you have to have really the infrastructure. And for example, in Africa, if you want to collect biosamples, blood, plasma, cells, etc., you need to first ensure that you have the power, you have the refrigerators, you have the liquid nitrogen, you have many different things. And then another thing that we have to take into account is the sovereignty of the data. So if you have the data, so for example, we are setting up the first open access iPSC biobank that is for stem cells, induced pluripotent stem cells. And we started with the idea of setting it up so that we can distribute this to groups from around the world so that they can have access to the cells that we have. And through that, we are trying to match that with biomarkers for, let's say, Alzheimer's disease. But one problem with that is, for example, in Nigeria, you have to ensure that whatever cells or whatever things that you collect, the ownership is for the country. And if you want to give access to other people, still it should not be in such a way that they control who they give access to. So now, a few weeks ago, the contact from the European Induced Pluripotent Stem Cell Bank reached out to me saying, we want to have access to the cells that you've generated. And I said, okay, that's a good idea. The only thing is, for them, once you give them the cells, then they control who get access to the cells going forward. The MTA is now going to be between them. And according to the regulations within Nigeria, and I'm pretty sure many African countries, the sovereignty has to be, by the, lead investigators in those countries. So I think this is one of the major issues that could be kind of in the way of such initiatives.
Okay, Philippe, quick reaction, and then I'll jump to the floor.
One point like this. In fact, what Damien showed before is that we need good data governance for this in advance. And the other things I wanted to put forward that, for example, you showed that we need standard, especially for metadata. I think it's a key issue. You were thankful you showed open minds on your slides, which is the one used at eBrains, developed in the European, HBP setup. So I think applying such, framework to data worldwide would help also, then to share data, because you're using the same metadata format already, and which helps already a lot for this data sharing. So I think it's...
So we have a question here.
Thank you for all. My name is Arthur Schreuder from Medbox Europe. And I'm happy with everybody who talks about this. This is our pitch. I hope that I make you happy. Because Damien, thank you. Because what you ask, we have solved that problems. We have an infrastructure, and I want to request on you, on the audience, fair data and the fair data principles. We implement it now in Europe, and they are federated data. And we do that not only in Europe, but also in Africa, and also in the States, and that kind of things. And we keep the data by the person, and we visit the data, and that makes the quality of the data better. So that's all the things. We have also the ethical parts, the digital contracts, readable for citizens. That is what's already now going to implement in 2026. So that is more invited, join us, and make the group, because we can operate it now. That's
okay. Thank you. Any reactions? We have another question at the back. Moreau, you make me walk today.
Thank you. A simple question. Have you followed the European initiative about the open space, about the transfer of the data in terms of operability and the FHIR? No? Because otherwise we are continuously reinventing the wheel. They are this group working. It is to create an open space for data transfer. And they are quite advanced, by the way.
Go ahead.
Hello.
Go ahead.
I think the identification of these two initiatives shows exactly what I was trying to talk about. We develop these good initiatives, but then a lot of people are not aware of them. If a lot more people are aware of them, then there will be no need to reinvent the wheel. And also, most of these initiatives also happen within a specific domain, and then do not address all the challenges. If it is maybe advisable to provide awareness of these initiatives so that others can learn, mutual learning, but then it can move beyond that to address some other challenges that were not addressed by.
Okay, and we'll see if it qualifies as a use case for Philippe then.
Yes, sure. Thank you.
All right.
Thank you, Fred.
Okay, so we have one more question, and then we'll have to conclude.
My name is Liwa Zell. I'm from the eBrains research infrastructure and the founder of Open Minds, so thank you. My question is rather we were talking about data sharing now only in respect of transferring data, but I just recently learned about a very nice way of also thinking about data sharing is about visiting data, so leaving them where they are, right? Not giving up sovereignty of the data, but then making infrastructures capable of addressing the data where they are located originally. And I think this kind of like federation network that we need to set up between infrastructures, between different, and this brings another problem, right? So different technology states talking about power that is missing and so on. So I wonder if this should also be addressed in this context rather than only thinking about the transferring, but rather about how can we solve the technical issues regarding visiting.
I think it was one of the points I made earlier, our platforms for data visitation. That is an interesting solution to some of these barriers. But also, I think what we should be thinking about then is to develop a global data space where we can then give people access to these visitation platforms. Because if we have platforms in different regions, in different domains, then it might be difficult for people to also to go to them individually. If we can have a global data space where access to these visitation platforms can be had so that people can identify which one is relevant to their research and then have access to it, that would be good. But before that, the infrastructure to house the data should be in place. From what he's talking about, the infrastructure for the data sets in Africa needs to be in place for people to visit. And that's also something that is not there in all regions and in all domains.
By the way, it's what I meant by roadmap. In fact, it's because, yes, we need also to take into account that the technologies are evolving, and they are evolving rather fast in this field. So I think the European health data space is also designed for this. At some point, it's not pretending, solving every problem, but to provide at least some guidelines for people to follow them, and then to avoid that reinventing the wheel, as you said, and being able to implement these federated technologies a bit better. I think it's the way to go, yes.
I like the idea of visitation, but I'm also in for kind of ensuring that this data, in terms of, let's say, biodata, is kept in other locations, just in case there is a problem in the main source of the data. Because if someone, for example, from Europe was to come to my facility in Nigeria, I think that's going to build capacity for people in my place, and also build collaborations for grants that can further empower the local setup in my place. But one thing that we are doing even for the stem cells is we have biobanks in Sussex in UK, we have a biobank in the United States. So we have distributed these cells that we've generated from Africa in these different locations. Only that before people access it, the MTA has to come through us. So that way, the control of the data is still with us, which is in line with our regulation, national regulation, but also we are giving, making it accessible to other people. But I know that, for example, in the Indian Stem Cell Initiative, I can't really remember the name, but I was in a panel discussion a while ago, and they said that one of the things that they do for their stem cells, for example, for their biodata, they are happy for someone to go there and use it in their facility, but it's not allowed for it to go elsewhere, which also makes sense because it helps in building that capacity. So I think these are all approaches that are acceptable. But one important thing that we have to think about is what Damien mentioned. How do we build the capacity locally in those places? Because at the end of the day, I think it helps in empowering the global brain community.
Great. Well, thanks for the great discussion. I again have the frustration of having to stop it because we are running slightly late, and the closing high-level panel is about to start, and I'm hearing that panelists or contributors are arriving. So I'd like to thank you. Maybe, Tony, you've made a really long way to come, so maybe you have a privilege of having the final say on this conversation.
Look, yeah, my approach, as I said, is collaboration over competition. I don't think any of us globally want to fall back into some Cold War mentality where everything is a threat. I think one of the great things about science is it can break down national borders. And I think as we face these enormous threats of brain health and other health conditions, I think we need to work together globally to enhance brain health and to solve all these problems. That would be my final comment.
Well, and that's a message that we can now convey to the closing panel of this conference. So that will allow us for a short break and stretching legs exercise, as the high-level panel will not be in this room, but in the main room, in the Salle des Arches. But feel free to, relax, grab a drink. But in 5-10 minutes, we should be back in 5 minutes. Okay, we should be back in the Salle des Arches. So I rely on you. Thank you.
Fred.
Thank you very much, Lisa. And if I can invite panelists on stage, Thomas, please, Pilar, and Astrid. And actually, Lydia could not be with us this afternoon, but has sent a video message that we will show at some stage. Grab a seat. There is no sitting order. Welcome. Welcome. And obviously, I need to also provide a word of apology on behalf of our former president, Monica Di Luca, as she was meant, and you may have seen her name on the program initially, but she was meant to be moderating this session. But she's prevented from traveling due to health issues. But she's really sending a really warm regards to all the friends in the room. Also, as we are discussing now, the outcome of work in which she has been deeply involved as president of EBC. Thanks for joining us, and Pilar, it's a real pleasure to have you with us as you're freshly in the job. You're not, you're for a long time in the commission, so you're not discovering things, but I guess that the function is somewhat new. Is there? I guess there's some degree of excitement.
Let me see. Yes. Hello everyone. My name is Pilar Aguar. I am too long in the commission, maybe, but still enjoying it. So I think that I will stay as
don't make me say that. I don't.
No. But anyway, yes, I'm freshly new as from the 1st of September in my current position of director in the DG Research People. Health and Society, and I think it's a very good name, but I am a kind of false newcomer because I am coming after 4 years and a bit working in DG Santé, but before that I was working in DG Research in different positions. So in a way or another, I have never been far from research, and it's a pleasure to be back. I won't go into more detail.
No, but
now.
it's a pleasure.
But no, it's okay.
It's a pleasure to have you, and thanks for prioritizing your participation this afternoon, as we are having the closing panel of a discussion that we started in another room. So there is a bit of a movers and shakers here, but it's really the peak of our conversation to close the CSA BrainHealth, but also then to preempt the start of the BrainHealth partnership. What is the feeling of inheriting one of these files as you are coming in? And obviously, we are always tempted to say what is the level of ambition for the future, because it's a long-term project with a 10 years duration. And at the similar moment, we are entering the phase of discussion about the multi-annual financial framework, what the FP10 is going to be, etc. So what can you share with us this afternoon? That's the way I should phrase it. In terms of the longer-term trajectory with the partnership, which is a source of excitement on our end, as you can imagine. And this is really something we're looking forward to working on together with you and your team.
Thank you. A quite interesting question, but I will reply with a question. What is the level of your ambition? Your ambition, you as partners, you as members of this community on brain health research, what is the level of your ambition? because we are hoping that we are really listening to what has been said these days. We're really hoping that you are kind of bringing that very high ambition yourselves. Now, obviously, this is a very important event for us. It's the end of this CSA, and I would say that it's more than a research project as such, or a simple research project. I want to believe that this is a key point in brain health research. What I mean by that is, yes, we have invested a lot. If I look, back, there's been, in the last 10 years or so, we have invested 7 billion of European money into brain research. 7 billion in 10 years. That is significant. And it has been invested in different parts of the European framework programs. It has been invested in blue sky research, or more, also in research or more and innovation. It has been invested also in infrastructure, but 7 billion, it's a quite significant, important investment, I want to believe. Now, coming back to your CSA, we want to see this as a key point, because I want to believe that the strategic research agenda that you have identifies not only the priorities for the coming years, but also somehow a roadmap to get there. And we are counting on you to really make this reality. So this is where we're standing. It's difficult to be in the last panel of the day, because you have heard also from Manuel himself how much invested we are and how much invested we want to be. It is also true that the new MFF is coming. Well, MFF is the jargon we have for the multi-annual financial framework, which is basically the whole investment for Europe, not only research, obviously, but we are quite excited because it includes still, which is not the case for other parts of the Commission, a very significant and earmarked proposal for, again, FP10. Many of you know what FP10 means. So it is, our proposal is doubling the budget. And that means that we are, as you have heard probably a lot of time in these last weeks and months, we're really putting research and innovation at the heart of competitiveness. And let me define competitiveness. Competitiveness, it goes way beyond industrial competitiveness. And I think the previous speaker has made quite a significant point. Competitiveness is related to brain health, because at the end of the day, when we suffer, it's not only one of us that suffer. It's me, it's my family, my caregiver, my health system that has to take care of me. The ripples go beyond that community. They really affect the economy. So it's pretty important, and I want to believe that you're going to play a significant role on that. So this is how we see the future.
Well, thank you. It's a great introduction, and gives me an opportunity to turn to you, Thomas, as you chair the Scientific Advisory Board. So obviously now we are going to be held accountable for the strategic research agenda, which is out of, you're partially responsible for it. So is it good enough, and can we really engage our responsibility there?
So I really hope so. We try to do our best, and looking at it now, I think it's really, I would say it may be a milestone, because it takes a very holistic approach to the issue of brain health. And I would also say that it gives a lot of approaches to realize all the opportunities that are given now by looking at it in such a holistic way. Because in a way, several things come together. So technologies have advanced in a way that allow us not to look at, very simple distinctions between disease and non-disease, but we can now define major neurodegenerative diseases in ways that really predate the onset of symptoms by decades. We can tell if somebody will get Alzheimer's 10, 15, 20 years before the disease develops. Now it's the task to define the trajectories on an individual level, and that will allow us to develop methods to intervene very, very early in the disease process. And that, in a way, is why we change from looking at diseases at brain health, because it's very, very early in the development of, and the normal trajectory of a brain development that we can intervene now and that we can focus on now. And I think that's a wonderful opportunity, and I hope that our Sriya has focused on that and gives a framework for the next 6 or 7 years to design the projects that will approach this goal.
So it was obviously presented and discussed in a session earlier this afternoon, but to the point that Pilar was just making on the impact to society, to health systems, but to individuals and their families. Can you maybe give us a glance as to how it is responding to these needs? Because Astrid, I'd like to turn to you right after.
Well, yes, as I said, it's moving from just kind of the repair aspect of traditional medicine. Somebody gets sick, goes to a doctor, and hopes that the doctor can help, to a more holistic view, looking at individuals who are still healthy and trying to promote and sustain the health of the brain. And I think that's a wonderful opportunity. And as I said, as technologies have evolved in a way that allow us to look at that in so much detail and so much advancement, I think that's a great opportunity. And that will translate to individual people. It will allow us to give help and support the healthy aging of many, many people.
Astrid, how would you relate to that? I was trying to interpret your expression to see the level of alignment with what Thomas was saying, but also in very concretely, we were discussing with Raluca, who was with us on behalf of Gambian. She was saying at the end of the day, patients are the end users of these entire, I wouldn't call it a black box because it's now well structured and there are very concrete mechanisms, activities, integration of research outcomes. But she was calling patients herself end users of the system that need to be incorporated, that need to be part of the co-creation and the design of the system, which is also put in place. But where do you see EFNA's role in advancing the understanding of patient needs? And do you feel that so far it has been integrated?
I think, to be honest with you, Fred, I think I want to say something about what's important to us, not how EFNA can play a role. And I want to touch upon, we have high expectations and would love to have high ambitions on behalf of the partnership here, because we need it. And we think there is a huge potential to harvest synergies through having better coordination of the resources that we are able to put into this partnership. And then also, of course, I would like to touch upon what you said about we are now able to more and more detect really early signs of a disease happening in the brain or something going wrong in the brain. And I come from the space of Huntington's disease. That's in my family. And that's a rare disease, neurodegenerative, where we have had a lot of recent kind of, I would say maybe breakthroughs in exactly what you are saying. So for that's important, needs to continue to detect more of those. But what we see is really missing is how can we conduct clinical trials in that space, because people are not sick. There is just small signs happening, small things happening in their brain, which we can do something to alter, to delay disease onset. But how can we have regulators with us in terms of agreeing on how to measure these changes, because it's not functional. It's biomarkers or whatever that and that's a big missing link here, which we need to bring in all the way to realize therapies.
Thomas, I see you nodding.
It's certainly one of the major aspects in the SRIA that needs to be addressed, and that will be the basis of one of the calls that will come up I'm sure, because I absolutely agree. You know, it's as long as you can tell people, you know, best thing you can do to keep your brain healthy is have a healthy diet and go a lot of running and have a lot of exercise. That's fine, you know, that everybody can do. But if you want to have a specific intervention based on a biomarker definition of a disease developing, that's a really big step in the regulatory world to take, and that's what we have to take on now, because that's a real big opportunity that is given to us.
But Astrid, maybe to make a very small parenthesis here, but an important one, because in your space, in Huntington's disease, we've seen a major leap forward in the last couple of weeks. Do you see, what is the analysis that you've made at the Huntington's Disease Association in terms of the hope that it is bringing, and do you anticipate more of that in the future? And if there were any bottlenecks that you identified, what would there be?
Yeah, I think maybe many of you saw the news that broke exactly 2 weeks ago or something like that, where the message from the mainstream media was more or less that Huntington's disease can now be treated successfully, which is not really the case. It's a clinical trial with 12 participants who show really significant and positive signs of having, you know, delay on their disease progression. So it's amazing, it's really good and wonderful, but we are not there. So we received, as a patient organizations, multiple, you know, requests from patients desperate to say, where can I get this shot? It's a one-in shot into the brain. So also about how to message and to manage hope, because we are really hopeful. And there is, somebody said in the parliament yesterday that the brain is a black box. I don't agree. I don't agree. The brain is very complex. There is a lot we don't know, but we are learning more every day, which is significant and can end up in understanding better how to, you know, influence brain health. So what do I see as hurdles? One of the things I said, how can we conduct clinical trials on healthy people who not want to face necessarily their future in terms of developing Huntington's disease or Alzheimer's disease or whatever disease? Do you want to sign up and say, can you check if I have these, you know, small changes in my brain? It's not something we necessarily volunteer to like that. So it's also about really educating ourselves, understanding what's needed from the community, from the population. We are not patients, it's the population, it's the citizens.
Yes, it's the paragraph on acceptability of treatment and therapies that is part of the SRIA. Is the cultural and societal acceptance of these therapies, or even of the detection itself. Pilar, the discussion that we had earlier addressed obviously speeding up innovation, as we just discussed, but also investments into basic neuroscience. So the whole ecosystem is really in demand and in need for support, and obviously there is only so much that we can do, and the elephant is, you know, being eaten hopefully in its entirety, but one piece at a time. But we are now coming up with a partnership in a very interesting context, and also at a global level. The situation of Europe is moving I would say one step ahead. We are facing the intersectoral global action plan on epilepsy neurological conditions, the other sectoral action plans of the WHO on dementia, on mental health. So this need of having a cohesive approach to brain health, it's something that now we have done at the European level. But we also see member states developing their national brain plans. So in shaping the SRIA, there was a stock-taking exercise of all those national plans and where they exist in Europe, whether they are fragmented or holistic again. Do you see a change? And I'm tempted to ask also from DG Santé, where you were in the past, DG Research, where you are now. Can we hope that there is also some degree of movement with seeing the partnership as a very concrete step in that direction? Or it's being too ambitious?
No, it is not. I mean, I know that the European partnership has been cited as the flagship of some policy communications and plans. What I mean by that is Europe, at the European level, we do not only just fund research and then forget about the rest. I think that a couple of things that have been said by colleagues around the table today was inclusive, synergies, and this is how we see things. And synergies mean also with other researchers working in similar spheres or parallel spheres where there can be, obviously, we can benefit from working together. It would be foolish to think that the European Brain Partnership is going to address everything at all levels and would be, successful with all the single things that we want to do. That's not necessarily going to happen. What we want to see you is also addressing this inclusiveness, so talking to stakeholders that are patients, caregivers, industry, which is an important part of the ecosystem as well, regulators, member states, competent authorities, so other researchers in the area, people dealing with infrastructures. So if we can manage to get this inclusive approach, what we are going to achieve is the synergies that you were asking for. Obviously, one of the areas that has been mentioned is the clinical trials. I mean, you have all heard about the Draghi report. I suspect that not that many people around the table or here today have read it, but it specifically mentions clinical trials as one of the examples of fragmentation. Anleta said it in her report, fragmentation in the single market. There is not the single market. You can buy anything, practically speaking, from everywhere, but the clinical trials are an example of where the single market is not working properly. And we know it, and we are committed to help with that. Now, this is, for example, an area where we are expecting you to be able to really participate actively and be also synergetic with other actors in the area. You mentioned rare diseases. There is a partnership on rare diseases. They are not necessarily having the same focus as you, or maybe the needle with regards of research and innovation is in a different place. It's not necessarily the same for you. But let's not forget that research and innovation doesn't happen in the void. There is a need to take research from blue sky research to collaborative research to innovation to deployment to the market, to the patients, and beyond the patients, to the society as such. So we would expect you to think about also how let's say, your achievements, your milestone, your deliverables, your impact can be the starting point from other actors to really make sure that we make this a reality. And again, I want to stress it, competitiveness is not, and I'm sorry, I apologize to the people working in the industry, European competitiveness is not about European industry making money. It's about our well-living, our wealth in Europe, our values, and how do we want to protect the society that we have in Europe and the values that we have in Europe. And yes, of course, industry needs to make money, but that is a different story. So again, competitiveness is competitiveness for everyone, for the patients that have access, for the healthcare systems that are not overburdened, for industry, for researchers. There is competitiveness for everyone, but we need to make it together. Thank you.
Well, thank you. And I think what you're saying really summarizes the Commission ambition with this notion of ecosystem generation, because it's the whole of this ecosystem that should benefit from an effort like this. Thomas, reflections from what Pilar addressed, and would there be, where would you start? Which bit of the elephant would you start with?
I think one thing that I heard, what I think is very interesting and is a big task, is to make the common market work for clinical trials. We are just now setting up an investigator-initiated trial with a specific compound in Parkinson's disease, which is a common disease, relatively common disease, but it's specifically targeted for Parkinson's patients with specific genetic variants. So that makes it suddenly a relatively rare disease. So the trial will be set up as a multinational trial with 6 different academic centers across Europe, and it's a nightmare. It's a nightmare to get all the regulations in place, and that would be something that we would really, really appreciate if, and maybe we have these calls in the SRIA that every second or third year that address specific legal, societal, and so on issues. That could be one where we work towards improving this really, really very complex legal framework.
We are aware that the multinational clinical trials are not easy. Let me say it like this. We are aware that different member states and different countries have sometimes different approaches. Time is of essence, and there are other factors, not only the regulators, there are other factors that affect them. Now, so we are very committed to that. Let me point out 2 things. One is, in particular, I think relevant. You have heard that we have launched the Life Science Strategy. We did it in July this year, and it was a big effort, and I think that the colleagues of DG Research have been very actively working on that. Also reaching out to other parts of the Commission, they really have nailed that, because clinical trials was one of the areas where we recognize that we need to work on that. The previous speaker also mentioned the Biotech Act, where a lot of hope it's put. We are working on that matter too. But we are certainly in our, let's say, particular area of work within the Commission, because there are different actors there, really looking into how to improve or how to help clinical trials I'm always referring to multinational clinical trials in that respect. So we are launching, or really about to launch a fund where the idea is to really support beyond the regulatory aspects that are with other colleagues, but beyond that, how to support a better coordination, better understanding, better alignment of the different countries in this matter. So I want to believe that this is going to be a very important breakthrough also for us.
Thank you.
Can I comment
of course, I wanted to invite you to comment, but also on this notion of competitiveness to the benefit of patients. So, but
yeah,
go ahead.
I've been thinking lately that there should be a more, a sense of urgency in this space, because when COVID hit us, do you know how many people who have been registered by the WHO as dying from COVID since the start? 7 million. According to WHO again, in the recent report that was released, 11 million people die every year from neurological conditions. So the urgency that COVID kind of, just because of, the nature and many factors, pushed us to be creative, innovative, bold in a way. And we managed to develop something super fast. I wish we could adapt some of that boldness and innovative willingness to our space, because we have been under-prioritized since the start. So that would be really something that could maybe, help us streamline more across countries. How do we conduct clinical trials? Can we have the ethics standards? Can we have things kind of more united? So it's easier for academics, it's easier for small companies, and it's easier for everybody to conduct trials and have things happen. It's real suffering out there.
And particularly as you're taking only one metric, which is mortality. So we say brain disorders are the second cause of mortality in the world and in Europe, and the first cause of disability, which is probably even more striking and more impactful, and bringing us back to the point you were making, Pilar, to affecting individuals, but also their direct surroundings and society with a long-term effect. I don't know how you feel, but I was thinking of opening questions to the floor. Are you happy to integrate, and are you ready to respond?
Absolutely not.
Always ready? Okay. Any questions for our panel? Come on, folks. I know it's 5 o'clock, but Thomas.
Thank you very much to the panel. We've already had a series of...
Sorry, Thomas, for the ease of the panelists, can you introduce yourself, please?
Hello, sorry, I'm Tomas Ryan. I'm a professor at Trinity College Dublin. I'm also a board member of the European Brain Council, and I represent the Federation of European Neuroscience Societies. Thank you very much for an illuminating discussion. We've already had a discussion about details and concrete aspects of the Brain Health Partnership in the previous session, but I'd like to ask a philosophical question which underpins all of this, which is that, do we really want science to be guided by committees and consensus when we're prioritizing how to enable the next generation of scientific discoveries? Now, this is a cultural feature of European research, particularly in Horizon. A lot of the budget is dedicated to these top-down research programs. But if we look around the world, what's really successful in the UK, the Wellcome Trust, in Germany with the Max Planck Society, and indeed in America with the NIH, none of that really works from a top-down perspective. And the most competitive science, the best and most unanticipated discoveries, tend to come from investigators who are finding creative ways to push boundaries and are competing with each other intensively. And I think the European Research Council, which is a part of Horizon Europe, of course, is one of the best examples in the world of that. So I'd like to put it to the panel, do they think we should be shifting our balance to be less about top-down research and more about bottom-up investigator-driven research, and finding ways to support those researchers in doing the work, which of course is about fundamentally the budget and our ability to use it. And as an addendum, twice in today's meetings, people have said in panels that public funding for research in Europe is more or less the equivalent of America and other countries. That is not factually correct. In Europe, if you combine European research funding at the Commission level and also member states, we spend about 15 billion euros per year on biomedical research. We don't know how much we spend on neuroscience because no one has added that up for individual countries, but it's 15 billion for all of biomedical research. The US spend about $50 billion per year on biomedical research through the NIH, and that's in real terms. So per capita, we're doing even worse. We're spending less than a third of America's spending on biology. Now, that is something that we need to improve in general. But broadly, what I'm asking is some consideration of the Haldane principle, which is that we as political advocates, but also policymakers and agencies need to be supporting science, but that the nature of science itself needs to be left to the individual scientists who are doing the work.
Thomas, I'd like, Astrid, you...
Yeah, can we please have more than one thought in the head at the same time? Because we need to do both. We need to be directive on something we want to achieve. You talked about a roadmap. There should be some direction to what we want to achieve. And there need to be the flourishing of the thousand blooms. I mean, the academic freedom and this innovative, and where you cannot anticipate what your results would lead you to. And we shouldn't. So both. Thank you. Isn't that there is a famous cartoon saying that? Yes, thank you both. Or all.
All right. Thomas?
I would agree, yes, and I think I would absolutely support your statement that we are, way behind the U.S. in terms of per capita spending on research, biomedical research, and so on. I also would, I would take your position if the funding for the partnership would come at the cost of the ERC. I think both approaches, the bottom-up approach that is represented in the ERC and the more top-down approach by trying to have programs set up. Within those programs, it is really pure scientific merit that selects the different initiatives that are being funded. I would hope so, at least. But in general, we need both aspects of the funding of biomedical research.
Thank you. Pilar?
Thank you.
You notice I gave you a bit time to think about your replies.
No, I didn't. I mean, but I'm happy that they actually are practically anticipating what I was going to say. We need both. We need both also because not all type of research can be done by the same type of, let's say, consortium. Let me leave consortium, use it in a broad manner. It can be just one research team, or it can be a number of research teams. So the scale and scope is also important. As it was said, we have to have some directionality, and that doesn't come from, and it doesn't have to be at the expense of cutting the excellency, because it was said, within this space, with this arena of collaborative research, is excellent that matters. Okay, so that's one of the things. I certainly believe that yes, we need the European Research Council type of research, and we need the collaborative research, as we also need research which is closer to innovation and pre-competitive development, because that is also important. And things would not necessarily happen if we were not there to kind of try to steer a bit these things. That's the first thing I wanted to say. But with regards of the expenditure, well, you have a wonderful opportunity. And it was said here, I know, it was said here this morning. We have made a proposal, quite bold, double the money for innovation. That's what the Commission has put on the table, right? Okay, I shouldn't say this because it's horrible, but I'm old enough to have lived through this experience before with previous research framework programs, where the Commission also did a bold proposal. And at the end of the day, you as Europeans know how this works. We can make a very, very, very bold proposal, which is what happens with Horizon Europe, with Horizon 2020, and before that, when we call them FP7, FP6. Some of you might have been even there before. And then the discussions take place, and of course the Parliament always also is in line with us, also wants a lot of money for research, but the Council, the ministers, all your representatives that sit around the table, they have also, and I don't want to say other competing priorities. I'm not saying research is more important or less important. I'm not here trying to grade where we should be, but you have not only the opportunity, but I would say even the duty to pass this message that yes, research and innovation, it's capital for us, for our competitiveness, for our society. You have the duty to go and knock on the door, not, as it was said here, not on the research ministries, because of course they are very happy with our proposal. But, you know, you need to go beyond. You need to touch on finances, Ministry of Health, Ministry of whatever. I mean, it is important, and or in your case, the Department of European Affairs, which basically it's, I mean, I'm referring to the Irish, the name of the Irish department, for European Affairs, basically. Because the research communities, of course they understand. The research ministries or agencies, of course they do understand. But we need your voice to be heard by the other actors. We need your voice to really reach out, and the voice of the patients, and the voice of all the communities that are important for our, as I say, ecosystem. So it's not about talking to the research individuals or research agencies. It's talking to the others that are going to be sitting around the table. And it's also, let's be sober, member states, as Europe, we have a defined budget. It is what it is. We don't make money in the printers by night. So we have competing priorities, and this is what LICE is about. If you manage to pass the message that research and innovation is critical for Europe as a continent, I think that we have a good, fair chance that we would improve or increase the budget at European level. And let's not forget that this is only a part of it. Because as you rightly said, there is also the national research funding, which is not equal in all member states. This is also an area, but we are not here to discuss that part, but this is an area also where improvements can be made, maybe. Thank you.
Well, I don't see why not. We could not be discussing that, but you know,
because I'm not here to talk about member states.
Nobody's watching us, so that's fine. No.
Okay.
William and Ulrike. So maybe. Oh, and Mauro. Okay. So 1, 2, and 3.
Right, Mauro. I would like to thank Arnie for the WHO statistics, but also to mention in the equation why it happens so quickly. The terms profit was omitted, and if you look at the value of the stock of those companies at the time of COVID-19 and compare with what it is valued now, you would understand the difference.
Any thoughts, reactions? Who has the mic? Ulrike, you've got a mic? Yes?
I wanted to comment on the discussion point before.
Yeah, sure.
Oh, okay.
Sure.
Good. So
Look, it's the end of a very long first day, so you know we can take full liberty now. So.
Okay, so my name is Ulrike Bussow. I'm the coordinator of the CSA BrainHealth, and I just wanted to comment on your contribution there, because as Pilar pointed out, this is we try to describe the structure of the BrainHealth partnership, and it's really important to hint at there is 30% funding of the Commission, and 70% of the funding is coming from the member states. And if you look the way the funding stream is coming, it is not the ERC component in there. So there is Max Planck funding and whatever funding in all the member states, and this is additional funding stream. So it's not, and what we should do, and Pilar just pointed that out, is not to cannibalize on each other, being basically saying top-down funding or bottom-up funding of research should be balanced in another way, but we have to point out to our parliaments and the other ministries in the game why it's so important to have this kind of funding stream, because it's not on behalf of the ERC or other funding streams. This is extra money coming in. It's 70% of the BrainHealth partnership is coming via this funding stream, and we have to convince our parliaments in every member state to keep up with that funding stream in the next 10 years. And for that, it's important not to complain that it's not enough funds, but to give them arguments to argue against other budget restraints they are having, and to make the case in these kind of parliaments, and to give the research ministries and the other funding agencies within the partnership the arguments why we should keep up with that kind of funding stream.
Thank you. Is there, you want to respond to that, Thomas? No, I don't know if you're raising your hand. Yeah, you go ahead.
No, just to clarify, I know this is not taking away from the European Research Council, nor is it a threat to the European Research Council budget, because it's not comparable financially by more than an order of magnitude. That's not my concern. My concern is the philosophy of top-down research being necessary for the future of brain science. I'm not convinced that it is. I would argue that you can have a philosophy of balancing both. But I think if we lost bottom-up research, then we would not be doing serious science. And I think if we lost this top-down research, I actually don't think we would lose much. I think if we moved all of our funding to investigator-driven research, I think all of the evidence suggests, the scientific study of scientific outcomes would suggest that we would get better scientific outcomes if we did that. Now, I don't think that's a popular thing to say in this context, but I think all of the evidence and all that we know about scientific research bears it out. Now, I understand we have the pragmatic issue of persuading policymakers to fund neuroscience, and it's easier to do that with these top-down labeled projects, which says that we're going to make progress in all these things in a prescriptive manner, and then parceling out relatively small grants to large groups of people. But though it's valuable, I think that it's a very expensive political premium to pay in order to get a point across. Now, I know that's a provocative point to make, but that is what I'm saying when I'm making this comparison. And with respect to the money from member states, I think the CSA for Brain Health Partnership is a fantastic enterprise. I've supported it completely. But it is important to point out that the 400 million, 350 million co-funding from member states is coming from other pies. So in Ireland, we're part of the Brain Health Partnership. The money that is going to that is coming away from the Research Ireland and Health Research Board budget, which would otherwise be going to the grants. And I'm fine, I think it should be put towards the Brain Health Partnership, but it's not new money, it is already allocated money. So the new money is the 150 million.
All right. I'll probably bring the conversation back on stage, even though I find it's quite interesting that it's moving around. Anyone wants to react? And we have other questions as well. So any reactions?
Well, maybe just one brief reaction. It's not necessary that, you know, the money that, of course, on the national level, there's one pot of money, and they dedicate part of that now to the Brain Health Partnership, but it's not at all clear, I think, that it would stay in another pot, because others could take it completely unrelated to research. You never know that. So I think we all should try to make the argument that on both levels, the bottom-up research and the program research, they're both trying to advance one thing, and that is, you know, progress in neuroscientific research that eventually would result in improvement in brain health.
Yeah, thank you, Thomas. Astrid.
Yeah, and I think we need to build the infrastructures to end up something that is helpful for people. So I think, again, I can bring an example from Huntington's disease, because you say you don't think we would lose anything if we don't have any top-down management of this. So in Huntington's disease, the third biggest foundation in the United States, CHDI Foundation, has decided 20 years ago, we want to cure Huntington's disease. And they have unlimited resources almost. So they did. So they built the infrastructure with the patient registry. It's the biggest one in the world for a rare disease. And they did support researchers all over the globe for a direction. That's why we see these news now on Huntington's disease being really in the forefront of this research. So I completely disagree with you. I really value the value of all these blooming flowers and from down up, but we need both. I will argue that.
All right. No further comments. William, you were next on my list.
You agree to disagree, which is fantastic.
Well, that's the beauty of you know, this meeting, because it's not to be taken for granted always. So yeah.
William Stevens of Tech Tour. Let me congratulate the European Brain Health Partnership. When I thought about it first time, for me the asset is, yes, 500 million as a commitment or as an intent, but it's also all the member states around the table, or the funding organizations deciding to do that together. I think this is excellent. Why? Because we are talking to a lot of entrepreneurs, startups, scale-ups, investors, and they see the biggest structural problem in Europe is fragmentation. So that's why great entrepreneurs from Estonia or anywhere else will go to the UK as a test market and then to the US, because it's simply too complicated to develop, deploy their solutions in Europe. So my question is, because it's always easy to make, you know, challenges, practical question is, could the partnership, particularly with this extremely valuable asset that you have these relationships with the funding agencies, play a role indeed in bringing forward issues that are important for fragmentation, but also the issue of more attention is needed for neurolongevity, mental health. They're all related. And actually, we are worried with drones in the air for defense, so we decided to increase to 5%. We heard from Mr. Ryan there that the defense agency in the US is funding research on neurosciences, which makes a lot of sense, because the next challenge is personal sovereignty. It's personal sovereignty. It's a lot more worrisome than a drone in the air. So I think we also must work together. Perhaps the opportunity, is there an opportunity through the European Brain Health Partnership to have this debate? Where is the future? How can we reduce fragmentation, but also how can we bring it on the agenda of those funders and including private investors that perhaps have more pressing needs?
Thank you, William. Thomas?
I think that's a very good question, and I think that's one very important aspect of the strategic research and innovation agenda: break up silos. Now, we have in Germany, where I'm from, there's a division between neurologists and psychiatrists, which is very traditional, for 100 years, and it's hard to overcome. The brain health agenda really tries to ignore those traditional divisions and tries to formulate approaches that will, be approachable from both sides or from many sides. And I think that's a very important thing, that we break up those silos and that we reduce fragmentation.
Thank you. Further comments?
Yeah, let me just confirm what you said, because 5 years ago when I left DG Research, there was this more traditional approach, and the proto partnerships or thoughts were not as inclusive as the current partnership structure that I have seen. So I can confirm that indeed this is part of the fragmentation. The other part of the reducing the fragmentation I've mentioned, and I want to repeat it. This brain partnership is not going to be the only one operating here. There's the opportunity to, work together or closer or align or cooperate or whatever word you want to say, with other existing partnerships. I've mentioned the one on the rare diseases, but it's not the only one. We have other type of partnerships in Europe. We have the Innovative Health Initiative Partnership, where we, Commission, are partnering with industry, and where there are opportunities, I would say, for, let's say, to move the pipeline further. I'm not saying that it has to be the brain partnership, as I mentioned before, has to go from 0 to 100, but you can bring this idea of advancing things. There's also the European partnership with African countries on clinical trials, where we have also the opportunity to explore what has worked there for overcoming the fragmentation of clinical trials. So, there are a lot of actors in the world. There's the European Innovation Council, which has a complete different approach to things, that then, where innovators, as you have mentioned, or startups, or even medium or SMEs, can bring forward some of those, research breakthroughs that I'm sure you're going to bring, closer to reality. Because at the end of the day, research, I've also learned that with time, is that this is a continuum. It's not something like the European Research Council, the collaborative research, the European Innovation Council. That doesn't work like this. Research doesn't work like this. It's a continuous flow. It jumps from one to the other. And we want you to help us doing that. Basically to push, to pull and push. To pull from that part, the blossoming that you mentioned, to push it to the innovation part, to make sure that at the end of the day, as I said, patients, families, healthcare system, the European society benefits from all the money that we are collectively, because at the end of the day, it's our money. It's our money. So at the end of the day, we want to really make sure that this makes a difference for people. And if we can convince that indeed putting €1 in research brings that much benefit for not only the ecosystem, but the society, I think that we will be making a very good case.
Mm-hmm.
Thank you.
Just a quick point on that, because we've been touching that in the breakouts on the liaison and the collaboration from partnership to partnership, and obviously the example of IHI, for instance, and a big public-private partnership linking to the EP BrainHealth, how it would work. What is the vision of the Commission in terms of fostering this effort of collaboration, avoiding and overcoming the fragmentation? And obviously this morning you may have heard also from Manuel that the question of the partnership per se as an instrument had come to the table. Is there anything up in the air that we could expect? Because we are very much attached to what is going to happen in January.
Yeah, I understand that. I mean, let me say that they are very, very early days. You know, the proposal for the FP10, let me use this jargon again, it's only been presented in July. As we speak, it is being presented to the Council, so the ministers of the member states. Basically what we are presenting is the proposal as such. There is no negotiation or discussion. Basically what we're doing is going through all the details now and making basically giving information on all the details of the proposal. This is happening. Then we're also waiting for the European Parliament, which will have an important role to decide basically, to nominate the committees that are going to look into the proposal and the rapporteur for, how this works. So I don't think I can say at this stage, yes, there will be European partnerships, or no, there won't be European partnership. This is something that, there are some mentions in the area, in the proposals, and this could be debated if they will be different or not, if how many, how, and so on and so forth. It's very, very early days. I would be surprised if we wouldn't have collaborative research, and I think that is part of your mandate and your mission to show that partnerships are beneficial because they overcome fragmentation, because they give alignment or at least better synergies with European funding and the national funding, and because at the end of the day, they are a better instrument for making sure that innovation happens and happens in Europe. And I want to say also something, because the previous speaker has said something pretty important, which is let's not forget about the upcoming generations, the new researchers that need to find also a space in Europe to work. And I think that also one of the areas where I'm pretty sure that your strategic research agenda has touched upon is the skills, how to make sure that we have skilled people, that we overcome also the silos, the classic distinction between psychiatrists and neurologists, and that we bring together different, let me use the term populations, with different approaches to make sure that we capitalize on these too. Thank you.
Thank you. We are very close to our end time for this discussion. I have the feeling it could last way much longer, but now comes the time where I'm asking you for words of conclusion, and maybe under the format of a takeaway, but also a wish. And I will call you the fairies of the partnership. Because it's a newborn to come in January, and it deserves maybe one wish for its future and for its life. So what is the takeaway of the conversation that we had, and what would be the wish that you formulate as a fairy of the partnership? Thomas.
Well, if I can start, I think what we can take away from this discussion and from the whole day is that it's a wonderful opportunity that we have that comes in a timely way now, with all the scientific developments taking place, and the wish would be, we're going to see the first transnational call next year, that we'll see many calls, that they will spark collaboration, that they will break down silos, and that they will bring a big progress to brain health overall.
Thank you. Thank you very much. Astrid, inspired? Or you need a bit more time, and I throw Pilar under the bus. Yeah, okay.
That's really nasty. I was counting on your time to make my wish. my first thing it would be that your wish becomes true. But my
that's cheating.
Yeah, I know. But in reality, my wish is that, say, in 5, 10 years' time, we all come back together and say, look, this breakthrough happened because we were here today, celebrating, the end of the CSA, but basically, printing or having a look at this strategic research agenda. So we made it happen for, again, the benefit of society, patients, healthcare system, national systems, industry, and Europe, because at the end of the day, we are all Europe. That's it. Thank you.
Thank you.
Yeah, I think I can just say something of the same. I really wish for, and we should set our goals to be able to point back and say this happened because this partnership we're able to connect and use the resources to the best capacity that we were able to. So we need to be able to point to some successes and say back that this is worthwhile, this way of working. Strengthen the synapses, isn't that what it is about?
Is that the way it was formulated? Okay. Right. Well, thank you very much, and please give a round of applause to our panelists. Thank you very much for your contribution and for this enlightening conversation. I obviously did not forget about the video message of Lydia. I could feel a bit of anxiety on my left, but what I propose is that we show it maybe at the end of the closing, because everybody is eager maybe to grab drinks and mingle again. So let's move to the closing, and then we show Lydia's video during the reception.